rightly, is to try and reduce the stigma of mental illness among Christians, and also to try and raise awareness of this whole issue of mental illness, suicide, and stress. This past few days, there have been various places I've been talking about coping with stress. When we talk about stigma, there's still a lot of stigma in our churches and our Christian organizations. And I usually give the example personally of my example. I mean, just after I retired, and I usually give the example personally of my example. I mean, just after I retired, and I usually give the example personally of my example. I mean, just after I retired, and I usually give the example personally of my example. I mean, just after I retired. I don't know what's happening, Dr. Sukumar. It is, yeah, there is a echo. Yeah, that's stopped now. Thank you. So my personal experience. Yeah, that's stopped. Is it okay? Is it okay? So my personal experience. Is it okay? Is it okay? So Dr. Sukumar, there's still an echo. There's a delay. Is it okay? So Dr. Still an echo.
Yeah, sir. Just give me a minute. I'm trying to solve the issue. Just give me a minute.
Certainly.
Sir, please proceed.
Okay, thank you. Yeah, so you heard, I give my personal sort of experience. After I retired in 2020, just a few months after that, I was diagnosed with bladder cancer. And so I'm a cancer survivor. When I go back, I'll be having another checkup as to what's going on after this trip. So I'd say, I can tell everybody in the church and Christian friends and others, I've got cancer, will you pray for me? But I often ask, what would have happened if that I had a mental illness? If somebody has a mental illness like depression or anxiety or bipolar affective disorder, schizophrenia, would we be as free to share that with our friends and others in the church, in our community, to say that we have that? And the question I usually ask is, why not? Why do we make this distinction between mental illness and physical illness that we suffer from? Now, unfortunately, this is going to be difficult to be a very interactive session. I prefer face-to-face, but with the way it is with people from all over, it's difficult to have that. And can I also say in introduction that I'll be giving you a lot of facts and we'll have a break in between from mental health before going on to suicide. It is usually done as 2-hour workshops, each of these topics, where we can then break into groups and discuss some of the questions. We won't be able to do that, but I'll put up the case examples and questions so that you can probably think about it and reflect about it on your own, rather than we being able to discuss it as a group. But hopefully, we'll have some time for you to ask questions and for some discussion. That's my hope. Let's see how the time goes, and if necessary, I can cut back on some of the slides so that we have time for that. So that's as an introduction. So first of all, I'm going to share the slides, and it'll be about our Christian perspective on mental health. And I said after a break, we can't all sit for 4 hours or 3.5 hours without a break in the Zoom session. We'll have a break and later after this, and then we can come back for the suicide bit. Sure. Can you see my slide?
Yes, sir.
Good. I'll minimize myself. I'm not minimized. All right. So mental health and the church, I've got it as, and Christians have traditionally viewed mental illness and mental health practitioners with suspicion. We'll look at that, why that's the case. And as I mentioned in my introduction, there is still stigma in the 21st century among Christians, even among pastors and Christian leaders. And we look into why that is the case. There's no difficulty accepting physical illness among Christians, but when it comes to mental illness, it is often talked about. I often say there are two ends of the spectrum of Christians that we meet. At one end, I would say the very right wing, ultra evangelicals who will say, oh, there's no such thing as mental illness. It's all due to spiritual weakness. If only they would read the Bible more, pray more, you should not suffer from spiritual weakness. That's one end. And then the other end, then we have others who say, oh, it's all due to sin. And because of that, they're suffering from mental illness. But my question is, what about physical illnesses? Or at the other end of the spectrum, which I call the ultra left wing, would be the ultra probably charismatics or Pentecostals who will say there's no such thing as mental illness. It's all due to demon possession, or it's due to being filled with evil spirits. So you'll find these two extremes, but many of us fall in between these two extreme views. Why is it not? Mental health. So first of all, we need to have a definition of what is mental health. Now, there's more to good health than just a physically healthy body. A healthy person should also have a healthy mind and a spirit. A person with a healthy mind should be able to think clearly. I hope you all agree with that. Should be able to solve the various problems we face in our life. We should enjoy good relations in family, with our friends and colleagues at work, and we should feel spiritually at peace and bring happiness to others in the community. This is a definition. We can find many definitions everywhere. This is one of the definitions World Health Organization definition of mental health. But then what do we mean by mental illness? Mental illness is any illness experienced by a person which affects their emotions, the way they feel, their thoughts, the way they think, and their behavior, which is out of keeping with their cultural beliefs. Now, this is important. So, out of keeping, let me finish that, out of keeping with the cultural beliefs and personality, and is producing a negative effect on their lives or the lives of their families. Now, the bit about the cultural beliefs and personality is important. Now, so, for example, we might, somebody is expressing something and we might think, oh, this sounds like a delusion. It sounds as though he or she is psychotic because of the things that they say. But that might be, we're comparing it with our personal culture and background. But what they are saying might be perfectly acceptable in their cultural background. Like if you go to a tribal area, they might have all kinds of beliefs which we might not accept as being the way that we believe, but we need to see that context before we say that somebody is suffering from a mental illness or not. If in their cultural background, their religious background, what they are saying is acceptable, then it is not a mental illness. And similarly, the personality. So we are all different. We are all made differently. We all have different personalities. So, and maybe the way they behave, they talk, looks as though there's something wrong with them. But we need to always go back and think, is this what they have always been? Their normal way of thinking and talking and behaving? Is it that the way they are? And if that's the case, then it's not a mental illness. That is what they are. They are all different. But if it has gone out of what they normally are and they are behaving and talking different from what they normally do, then probably we are considering a mental illness. And we also, this is important, what is happening to them is creating a negative effect on their own lives or the lives of their families. Then we consider that as a mental illness. So why should we be concerned with the mental illness? After saying all that, why should we be concerned? Well, many reasons. Because mental illness can affect all of us. Every one of us is prone to mental illness. No one is immune, let me tell you. Irrespective of age, gender, race, culture, or religion, all of us are vulnerable to that. Because it is a major public health burden. It is estimated that around 300 million persons are affected by depression alone. I'm not talking about all the other mental illnesses like schizophrenia or anxiety. Anxiety is the most common. So 300 million just who suffer from depression on its own. And about 57 million, it's been estimated, in India who suffer from depressive illnesses. 300 million from anxiety, 50 million in India, 200 million alcohol and drug use disorders, 50 million dementia. So this burden is not only in terms of health, but also affects human rights and economy worldwide. Because with mental illness, that means a loss of productivity, sickness, absence from work, unemployment, physical comorbidities. It has been found again and again, those who have mental illness are much more prone, because of various factors, we don't have time to go into much detail, to physical illnesses as well. Yeah, and they die much younger, many people who have got mental illnesses, increased hospitalizations, premature deaths, etc., etc. Because mental illness is very disabling. Mental disorders are among the 10 leading causes of disability. Because mental illness reduces life expectancy by 10 to 20 years. That's what's been found. So a patient with schizophrenia usually lives probably 10 or 20 years less than what he would have done if he was not suffering from that illness. Because mental illness services are inadequate wherever you go in the world. For example, in India, we know mental illness services are very inadequate. In the West, like in Australia, we have much more services compared to India. But even there, when you look at all the other medical services, we have a pecking order in medicine, and the top comes things like general medicine, surgery, and at the bottom comes, I usually say, is aged care, geriatrics, and mental health, psychiatry. And even in the Western countries, the amount of money that is given to those services are much less. So the treatment gap is 50% globally and up to 85% in low and middle income countries. Because mental illness can be treated. Many of them, if we find it, if we can help them. And very often, many of the medications, for example, that I use are actually less expensive than many of the medications that these days we use for many of the physical illnesses. Because mental illness, as I've just mentioned, leads to stigma. Another reason why we should be careful. And because those who are suffering, so as Christians, this is important. Everyone who is suffering is a human being loved by God. Let's remember that. So what are some of the characteristics of mental illness? Abnormal changes in a person's thinking, feeling, memory, perceptions, where we see things, the way we judge, judgments, which are longer lasting, not for short periods. We all can have, when we are stressed, when we have anxiety, we can all have our thinking being disturbed, our feelings being disturbed, we feel a bit upset and depressed. But that doesn't make us being mentally ill. When it is longer lasting, it goes on and on and on, resulting then in the person's behavior, then we say it is mental illness. These changes cause distress and suffering to the individual and or others. The more abnormal changes and distress affect the person's daily life, activities, work, and relationships. Now we come to what are some of the mental illnesses. There are 101 different types of mental illness, just like there are physical illnesses. if you look, we have all these different ways of classifying mental illness. ICD, the 11 is the latest, the International Classification of Mental Illness. You can find a way to classify mental illness. If you look at what's called the DSM, that's the American one, Diagnostic Statistical Manual, they have a way of classifying mental illness. Now, this is a method that I often use, which has been very useful for me. And I talk about what's called the hierarchy of mental illnesses. So on the top of this hierarchy are what we call psychotic illnesses. And psychotic illnesses are illnesses where patient suffers from psychotic symptoms. And what are psychotic symptoms? There are many of them, but the most common that we all know are delusions. What are delusions? False beliefs. If somebody is asking you for a definition for delusion, there are 3 criteria to be fulfilled before we can say somebody is deluded. What are the 3 criteria? A false belief. But we all have false beliefs from time to time. When we are growing up, from our young days, we might believe things. But if somebody comes to us and points out, brings proof to us that what we are saying is not right, we are usually willing to accept that. But a person who is psychotic, you can spend hours and hours and hours bringing all the proof in the world to say that what they are saying or doing is not right. At the end of it, they will say exactly what they were saying. So a false belief. So the second criteria is which cannot be corrected by reasoning. Arguing with them is not making any difference at all. And the third criteria, which I've already mentioned, is out of keeping with the person's background, whether it be the religious background, cultural background, whatever background, it is out of keeping with that before we can say it is a delusion. So it's a false belief which cannot be corrected by reasoning and out of keeping with the person's background. That's a delusion. And the other common psychotic symptoms that we all know as medical students and doctors, as I said, there are many different, but the 2 main ones are delusions. The other ones are disorders of perception, what we call hallucinations. And we have 5 senses, and we can have hallucinations in all the 5 modalities, sensory modalities: visual hallucinations, seeing things that are not there; auditory, hearing things that are not there; olfactory, tasting things that are not there; smelling things that are not there; olfactory, gustatory, tasting things that are not real; and tactile, feeling things that are not there. So when you have these kind of symptoms, we say there's a psychotic illness. And among the psychotic illnesses, here are some of them, some of the common ones. What is called acute organic brain syndrome is top, because that is another name for it is delirium. And when a person is delirious, they can have all the psychotic symptoms. That's why I put it right on the top. They can have all the symptoms and signs of psychotic disorders, psychotic symptoms, anxiety symptoms, and on top of that, they have also cognitive deficits, problems with their memory, problems with their orientation, and in delirium, their level of consciousness is also impaired. That's why delirium is on the top of the list. Then we have chronic organic brain syndromes or dementias. Dementias can have, again, the whole gamut of psychotic symptoms, but they don't have fluctuating level of consciousness. The level of consciousness is not impaired. That's why it is sitting behind delirium, below delirium. And then we have psychosis secondary to medical conditions. Many medical conditions can give rise to psychosis. For example, if you have all kinds of poisons that are affecting your brain, it can have it. If you have metabolic disorders, you can have psychotic symptoms. If you have endocrine problems, you can have psychotic symptoms. Psychosis secondary to medical conditions. Then we have alcohol and drug-induced psychosis. We all know that drugs can cause psychosis. Then we have schizophrenia on top of all the functional psychotic illness, schizophrenic psychosis. Then manic depressive psychosis, paranoid psychosis, psychotic depression, where a person becomes depressed and then begins to have psychotic symptoms like delusions and hallucinations. Then we have the below the list is underneath the psychosis is a neurosis we used to call, we don't call them neurosis now, stress-induced disorders, generalized anxiety disorder, phobic anxiety disorder, panic disorders, obsessive compulsive disorders, neurotic depression. So depression which doesn't have psychotic symptoms. Yep, neurotic depression. Somatoform, where our emotional problems are then converted into physical symptoms, and people present with sometimes paralysis, inability. So that's dissociative disorders that happen. Somatoform is more, they come with all kinds of physical complaints. You do all the investigations, nothing wrong there because it is due to stress and other things that are happening. Adjustment disorder, post-traumatic stress disorder. Then we have a whole load of personality disorders. You'll all probably have heard of, a paranoid personality disorders, borderline personality disorders, a sociopathic personality disorder, psychopathic personality disorder, narcissistic personality disorder, so many different personality disorders. And these are usually all disorders that are actually due to developmental years, things happening to them that lead to the personality disorders. Then we have a whole load of alcohol and drug-dependent disorders, eating disorders, anorexia nervosa, bulimia nervosa, all kinds of eating disorders, sexual deviations. Then we have intellectual disability with or without coexisting psychiatric symptoms and signs, and mental disorders of children and adolescents, another big, whole different area by itself. All right, now we come to what are some of the contributing factors to mental health or ill health. We usually talk of bio in psychiatry, as you know, unlike in medicine, we say, okay, we've got the COVID, people are down, we have COVID, we know why, because there's a virus that has caused that. Influenza is a virus, or we have a tummy upset is a bacterial infection. But when you come to psychiatry or mental disorders, there's no single cause. And so we call it multifactorial. All psychiatric disorders are multifactorial when we talk about the causative or the etiologies of psychiatric disorders. And in the past, we used to talk about biological factors, psychological factors, and social factors. About 20 years ago, lifestyle was added. And as Christians, we can also think about spiritual factors. So what about, so under the biological would be genetic or hereditary. There are some disorders which clearly have hereditary or genetic loading. For example, schizophrenia, there is no doubt at all. Thousands of studies have been done which show that schizophrenia, there is a genetic loading towards a disorder. Usually there is someone in the family that's had, and the person is left with that. But that doesn't mean just because we have a genetic loading that somebody is going to end up with a disorder. We all know that many of us have genetic vulnerabilities to all kinds of disorders. For example, diabetes. Many of us have genetic loading towards that. But that doesn't mean we're going to end up with diabetes. But if we don't take care of our diet, we don't take care of exercise, stress, then we might end up with diabetes as a result of all these other factors. So similarly, that someone with a schizophrenic loading doesn't mean that they're going to end up with that. But there is clearly a genetic basis for things like schizophrenia, bipolar affective disorders, and so on. Psychological factors, multiple psychological factors, from the time patient has been born, all kinds of psychological stresses that go on, which contributes to a person breaking down with mental illnesses, psychological factors, social factors, biological factors that's happening in our body, the neurotransmitter deficiencies in the brain and others, which then cause the problem. And obviously, the role of stress in mental disorders is a very important factor. Okay, and we are all different in the way we are made and how we are vulnerable to stress and how we respond to stress. We are all different. That doesn't mean that one person is stronger or weaker, but because we are different. That's what we have to understand. Now, when it comes to treatment about psychiatric disorders, again, just like the etiology, we talk about bio, psychosocial, lifestyle, and spiritual when it comes to treatment. Treatment will depend on the illness. Modern treatments have revolutionized the care even of those with severe mental illness. So treatments will fall mainly into these categories: biological, that means pharmacotherapy, ECT, brain stimulation therapies; psychological, 101 different types of psychotherapies, counseling, behavior therapies, family therapy, group therapy, play therapy; social, occupational therapy, vocational, recreation, housing, all kinds of therapies; lifestyle, diet, exercise, increasingly important. We talk about this with mental health patients. Sleep, even the importance of sleep, healthy living, exercise. For many of these mental illnesses, there is a great deal that can be done in this area that we're talking about. And then spiritual therapy, the importance of faith. Now, what has been done is, over the past 20 years, previous to that, there was very little studies. Over the past 20 years, and especially the past 10 years, there has been a multitude of studies being done in the role of faith when it comes to health. And the vast majority of these studies have been in the area of mental health. And what it has shown is faith, having a faith does not prevent a person from suffering from mental illness. But if a person has a strong faith, it helps in recovery. So a person who has a faith, the recovery seems to be faster and better if a person has faith. So remember that faith does not mean because of a person you have a faith, it's going to not make you more or less susceptible to mental illnesses. Right, now we come to some of what we are talking about when we talk about a Christian view of mental illness. So that was just giving an introduction of mental illness. So now let's go on into some of these areas. What is the root cause of illness or disease? God created man in his image. And we read in Genesis chapter 1, 27 and 31, God created man in his image. Then I looked at it and said, it is perfect. The only time God said it was not perfect was after created man and said, oh, this is not good for man to be on its own. You're thinking about God, the sovereign God, saying that I didn't do something right here. And so he created woman because he realized that relationship is central to our life. And so the importance of family, and it's very important. Now, humans have been created with a spirit, soul, and body. We don't have time to read all these Bible passages, but you can take it down and read it for yourself. And in 1 Thessalonians chapter 5, verse 23, it talks about the spirit, soul, and body. Now, this is called the tripartite theology of man. Not everyone accepts this tripartite theology. Some people talk about the bipartite, just the body and the soul, or body and the spirit. But the tripartite thinking is spirit, soul, and body. Sorry, I was just taking a drink. That's the tripartite theology of man. At the fall, we know sin entered the world. And what happened as a result of sin? And we read the Bible in Genesis chapter 3, verse 23. We read that the spirit of man died. What does that mean? Before the fall, God used to come every day. We know it says in the cool of the day. All of us in India, this has been a very hot summer. We know we are not going to stand in the midday sun and have conversations, have socialization. But in the cool of the day, what happens? Everybody starts coming out, going to the shop. People are in groups talking. And we know that the Garden of Eden was in Iraq, a hot place. And it says, in the cool of the day, God used to come down and walk and talk with Adam and Eve. That's what we read in Genesis. And God kept that bargain even after Adam and Eve sinned. On the day of their sin, he still came down and to talk and walk with Adam and Eve. But Adam and Eve could not face God and that was the separation that happened from God because of sin. And then following that, we know that God then threw them out of the Garden of Eden and had the angel with a sword, cherubim with a sword, to prevent man from entering the presence of God. So that is spiritual death, separation from God, separation from the relationship. The soul of man became diseased. Look at that term, disease. Where we often use the term disease, but where does it come? It means lack of ease. And that's why it's called dis-ease, lack of ease. As I mentioned, when God created man, man was at peace in himself. They were at ease. But the minute sin entered, what happened? We read that when God came, Adam and Eve hid. And when God said, "Where are you?" Adam said, "We are frightened." Fear entered, causing anxiety and fear. See the start of problems with man. And as a psychiatrist who has worked for many years, I can tell you an underlying emotion in many people with mental illness is fear, lack of ease or dis-ease because of this that has happened to man. And it is also interesting to know that, when we talk about God's commandments in the Bible, man often talks about the very, do not commit adultery, do not murder, do not steal. But what is the most often mentioned commandment in the Bible? It is do not fear, do not be afraid. Hundreds of times it is mentioned in the Bible. Many places they say 365 times it is mentioned, this commandment of God. But other places I've read it's more than 365. Why? Because God knew that this is an area of vulnerability for men. And so God says it again and again in the Bible, from the New to the Old Testament, do not fear. So where did it start, the fear? At the time of the fall. Fear entered, and man who was supposed to be at ease became dis-ease. The soul of man became diseased. The body of man became diseased. We can read in 3:16 and 19. It was after the fall that woman was told, "You will now bear children in pain." That's the start of pain for human beings, physical pain. And man was told, what? Now, by the sweat of your brow, you're going to make your living. So pain and suffering and turmoil started there. All human beings, this is the point I want to try and make here before we proceed any further, is all human beings, whether you're a Christian, non-Christian, whether you read your Bible every day, you don't read your Bible, you pray every day, all human beings are susceptible to diseases of the body, the soul, and the spirit because of the fall of man. And the other thing we need to realize is we are not built to be compartments, body, soul, spirit. We talked about the tripartite, but we are built to function as a whole. And disease in one area of our life affects other areas of our life. Simple example, I don't know how many of you suffered from COVID. Many of us have. Or if you haven't suffered from COVID, at least you have suffered from flu sometime in your life. What happens when you suffer from flu? A simple virus that affects us, and when we're suffering from flu, we feel physically aches and pains, high fever, loss of appetite, tiredness. But our soul is also affected. Do we feel happy at that time, full of life and happiness? No, we feel depressed. Do we feel that we are able to think clearly? No, we feel our thoughts are disturbed. Are we able to make judgments clearly? No. So our soul is disturbed. And our spirit is disturbed as well. Do we feel when we have got a flu to be going to church and worshiping God and reading the Bible? No, we don't, because our spirit is also impacted by a simple virus. So that's why I'm saying that our body is not built as compartments. One part affects the other, and disease in one area affects other areas. Spiritual or psychological? Psychological problems can present as spiritual problems and vice versa. Spiritual problems can present as psychological problems. Many Christians make the mistake of labeling everything as being a spiritual problem. Have you come across Christians like that? If you're depressed, it's a spiritual problem you're having. If you're having a physical, it's a spiritual problem. And what it does is, rather than helping the person, it causes guilt and more suffering for the person with the psychological problem. They are already feeling burdened, miserable, and you say this is all because you are not spiritually strong, because of your sin. You're going to make them even worse. Understandably, there are areas of overlap, as I mentioned, between the soul, psyche, and the spirit. The Bible does make a distinction between physical illness, mental illness, and demon possession. In Matthew chapter 10, verse 1, Luke 4, 18, 19, there are several references to insanity. If you read those Bible passages, you can take it down, please. We don't have time. It would have been good to be able to have read it, but we don't have that time, the luxury of time today. But take it, read it for yourself. It does mention about insanity or going out of your mind. Deuteronomy 28:28, when God, so even in the Old Testament, when God is talking to the Israelites, he says in chapter 28, the whole thing is about, if you follow me and my commandments, these are the blessings you will have. But then after that, the second half of the chapter, it says, but if you don't, these are the curses that will fall on you. And one specific curse on 28:28 is insanity. 1 Samuel chapter 21, 13 to 15, David, it says, when he went into another kingdom, he was frightened that he will be recognized and might be imprisoned or even killed by the king of that nation. So he feigned, it says in the Bible, feigned madness. That means he pretended that he was mad. That means madness or insanity was well known in the Old Testament. Jeremiah 29, Hosea 9:7, it talks about maniacal prophets. Acts 26, all these verses, 2 Corinthians, it talks about Paul being labeled as being insane and because of his learning. Justice said, you're going out of your mind, Paul. That means, again, insanity was a known concept. And Mark 3:21, even Jesus was labeled by his own family as being out of his mind. So what I'm saying is, insanity was a known concept. There can be a confusion between some kinds of religious experiences and mental illness. Yes, there can be. Sometimes both may be present in some patients. There can be both going on. And in fact, such people often gravitate to caring communities like a church community because they feel that we are going to care for them. So people with mental illness might come, and it's our role and duty to care for them, not to discriminate, not to stigmatize. Many psychiatrists, I recognize, many secular psychologists and psychiatrists think that spirituality, religiosity can be a precipitating factor for mental illness, but that is not true, and research has proven that that's not true. But you might still find secular psychiatrists and non-Christian psychiatrists or non-spiritual psychiatrists who might say that, or psychologists who might say that. Next is sin. All disease is ultimately due to original sin, as we looked at. And there are mental and emotional problems with a direct relationship to sin. There can be, for example, if a person is going into drinking a lot of alcohol, he's going to be an alcoholic and with mental illness. He abuses drugs, he's going to have drug abuse. So there are mental and emotional diseases with a direct relationship to sin. Just as there are physical illnesses with direct relation to sin. If you are sexually, there's infidelity, you might end up with sexually transmitted disease, etc. and etc. There are many examples of it. However, there is not a particular relationship between sin and mental illness. Old Testament example of Job. Job, when we read, so many things that have happened. If any of us were to go through all that, I don't know how we would cope. But Job, if you look at the example of Job, his friends came, and initially the four friends, in the first 4 chapters of Job, if you read, they did what we should be doing as perfect companions of people who are going through mental or emotional problems. They came, just sat with him, tore their clothes, put ashes on their head, and mourned with him what he was going through. But then after the 4th chapter, if you read, Job's friends became very spiritual and started accusing Job, oh, it must be because you did this sin, or you have not done this right. And they kept on, each one after another, started blaming Job. And what did God say at the end in 42:7? God says, you're all saying the wrong thing. This is not why Job is going through all this. And rebuke the friends for saying things like that. And New Testament, Jesus says the same thing in a statement. His disciples said, why is this man suffering this? Is it because his sin or his parents' sin? And Jesus said, it's neither his sin or his parents' sin. It's because God's name can be glorified. Terminology. So sometimes the terminology that's been used in psychiatry and religion can cause confusion, because it causes confusion. I'm not going into this much in detail, but we'll go on to this. Is an area I want to spend a bit more time, because many Christians, you see, will be talking about, this is not mental illness, it's demon possession or demonization or due to evil spirits. The topic has caused difficulties, conflicts, and suffering for many over the years. And it is due to wrong theology. Many have been misdiagnosed and mistreated over the years. Many, unfortunately, over the years, in previous centuries, many people suffering with mental illness have been beaten, have been drowned, have been burned on the stakes, and all kinds of things done to them because they were thought to be demons possessed, and that it was due to their evil spirits. We have done that, and even now we are doing it. In many churches, we do say that and do things like that. Now, when it comes to this area, there's a widely differing views among Christians and much misunderstanding about this whole topic. We know that there's a devil, and who was the devil in the Bible? When we read, it was the archangel Gabriel, who was Lucifer, who was supposed to be the brightest and angel in heaven, in the presence of God. But he became so clever, he wanted to usurp, take the place of God. And that was when God then threw him out of heaven, and he became the devil. That's what we read. And along with him were a number of angels who took his side and followed him, and they were also thrown out of the presence of God, and they are the evil spirits or demons. So that's what the Bible says about devil and demons. And, it is a reality. There is the devil, there are evil spirits. Sometimes you find some modern Christians who say, oh, there's no such thing as devil, there's no such thing as demons. No, but if you have Bible-based, Bible-believing Christians, we need to believe that there is a devil and there are demons, and the devil, it says in the Bible, is out there to steal, kill, and destroy. That's his purpose: steal from us, kill, and destroy us. And as Christians, we'll have more attacks of the evil one. And we read that demons cause suffering. Yes, read these passages. We do read how demons cause suffering. Physical suffering, mental suffering, it does happen. And it also, we read, demons were the objects of worship in those biblical times. People, and even now, people have indulged in witchcraft, demon worship, etc. It happened then, it's happening now. Demons had to be stood against. That's what Peter says in the scriptures. We have to stand against them. Jesus cast out evil spirits out of people, and we can read examples, many examples. If we go through the whole Bible, there are many examples of Jesus casting out evil spirits out of people. Matthew 4, these are just examples. 8:16, Mark 1:32, etc. And mainly, this is interesting, it is in the Synoptic Gospels we read about Jesus casting out demons. That means in Matthew, Mark, and Luke. But John's Gospel, interestingly, does not mention demons at all. That's interesting. Paul does not talk about demons. That's the other thing. St. Paul, who has written most of the books in the Bible, does not talk about demons, but about sin, personal, corporate, social, in demonized ways. Now, in the Synoptic Gospels, that is Matthew, Mark, and Luke, when we look at the passages in the Bible, there are 6 encounters with demons that Jesus had. For example, there's a demon-possessed Gerasene. It says when Jesus and the disciples crossed the Galilee and went to the other side, there was demon-possessed Gerasene, and some of the Gospels, they say more than one. And they were violent, they were aggressive, they were living in the tombs, and people left them there because they couldn't approach them because of their aggression. And we read that in Matthew 8:28 and 30 to 34, Mark 5:22 to 20, Luke 8, we find all this being mentioned, the demon-possessed Gerasene. We also read about a demon-possessed mute man. Now, what I was going to say before we go on to that, so that is, out of all these 6 encounters, this is a point I would like you to take. It is very important. Out of all the 6 encounters that Jesus had mentioned in the gospel with demons, this is the only example of a person who was demon-possessed who behaved like a mentally ill patient. The only one who behaved like a mentally ill patient. Or 2 people, there could be, in some passages, talks about 2 demon-possessed men. That's the only example. Then if we go on to the other mentions of demons, it was a demon-possessed mute man in Matthew and Luke who could not speak. Then we have a demon-possessed blind and mute man, Matthew 12. Then we have a Canaanite woman's daughter in Matthew and Mark. An epileptic boy in Matthew, Mark, and Luke who was demon-possessed. And a man in the synagogue in Mark and Luke. So, what I often, this is the point I'm trying to make. Demonization can result in physical, psychological, or spiritual problems. So in all these encounters that were mentioned, the 6 encounters with demons that Jesus had in the Bible that is mentioned, there might be more, many more, but what has been recorded, only one behaved, or you can say he was insane, or he or the 2 of them, they were insane. All the others, their manifestation was as physical symptoms and signs or spiritual problems. Now, so I often ask, very often when I started psychiatry, even now, sometimes Christians ask me, hey, is it mental illness? Have you not been, are not many of these patients you meet actually demons possessed? And then I throw it back to them. Why do you ask me that question? Why do you ask psychiatrists this question? Why don't you ask an ENT specialist, demon-possessed mute man? Have you ever asked an ENT specialist whether you have met a demon-possessed man? Or an ophthalmologist, blind man? Have you ever asked an ophthalmologist whether you have met a demon-possessed man or a woman? Or a neurologist with epilepsy? Why do you not ask neurologists whether you have encountered demon-possessed people? Why is it always only psychiatrists and when mentally ill patients that you think they could be demon-possessed? But the bulk of the examples in the Bible that we read or recorded are people who exhibited physical symptoms of signs when they were demon-possessed. But somehow it has crept into our minds that demon possession means that they exhibit as psychiatric disorders. Can we get rid of that thought? So psychological, there was only this demon-possessed Gerasene. We need a gift of discernment if we are going to deal with people with demon possession. If you read the example in Acts 19, some sons of Jewish priest, sons of Sceva, it says, started trying to get rid of demons, and the demons turned on them and said, Jesus, I know, Paul, I know, who are you? Or Peter, I know, who are you? And they attacked them. So we need to have a gift of discernment, and if in doubt, refer people like that. And the next thing I would like to say is there are more people who suffer from mental illness than demon possession. Remember that. Bible makes distinction between disease and demon possession in Matthew 4:24 and Luke 9:1. If you read those passages, there's clear distinction between mental illness and demon possession. There's very little in the Old Testament about demons and relatively little in the New Testament about demons compared to the bulk of the message in the New Testament. But we seem to always talk about demon possession. Yes, it is sad that some Christians in the church choose to single out people with mental illness as being demonized. As Christians, we need a balanced view on this topic and not cause more suffering and pain to those with mental health challenges. Okay. The next thing that causes problem between Christianity and mental illness of people with, in this whole area is what's called docetism. What is docetism? Docetism is a heresy in the early church, in the early centuries of the church that came, a heresy that said that spirit was good, but anything to do with matter was, including our flesh, was evil. And so because when Jesus came to protect Christ's spirituality and divinity, there was this thinking, the docetic thinking, that Christ only appeared to have a human body. He really did not have a human body. What we saw was not a real human body. That was docetic thinking. And then that Christ did not really suffer pain. The early church rejected docetism. Even in the early centuries, they said, no, that is not true, and acknowledged that Christ could feel pain and he suffered. Unfortunately, many Christians have unknowingly developed a spirituality that denies the humanity of Christ's followers, with denial of unpleasant human feelings such as anger and grief in the name of Christian joy, with damaging emotional and physical consequences. We often talk as Christians negative emotions. I don't like that term. It's emotions we have. Okay, what are negative emotions? We are human beings. We are not gods, or we are not supernatural beings. We have all kinds of emotions: sadness, anger, guilt. We have that. There's no negative emotions. We talk about anger being sinful, but does the Bible ever say anger is sin? Nowhere in the Bible, you read the Bible, it says anger is sin. What it says in the Bible is be angry, but sin not. So God recognizes that Jesus was angry in the temple. So it is not the emotion of anger that is sinful, but expression, how we express the emotion. that can be potentially emotional. If with our anger, we attack somebody, we kill somebody, we say bad words because of our anger, then it is sin. But feeling the emotion is not sin. And very often the problem with many of us is we try to suppress our emotions because I'm a Christian, I shouldn't feel this way. I shouldn't feel anger. Somebody upsets us, I shouldn't feel angry because I'm a Christian. And then it comes out in all kinds of emotional problems and physical problems. First is acknowledging what we feel. Anger is not sin. Yeah, it says in the Bible, be angry, but sin not, let not the sun go down on the anger. Do something about it. You know, in some ways, I wish that many of us Christians in India were angry with many of the injustices that go on. You know, I have a daughter who is here. She spends half a time in India because she's passionate to try and get rid of this gender violence and abuse that happens among females, and the rape culture and the domestic violence. She's trying to get into schools to teach young children how we can respect each other. She's passionate because she has seen cases of rape and feels angry about it. So I wish that many more of us were angry and do something about this. So many of our Christian brethren in North India are being persecuted, churches being torn down. Do we feel like, what are we doing in many places in South India? What are we doing? I wish we were angry to do something about it. So denial of human development, when we try to deny all this, it damages us. Denial of human development causes problems. Denial of human value, with consequent poor self-esteem or self-image. Now, when we look at Bible characters, there are many Bible characters who suffered from mental illness. Prophet Elijah's mental meltdown in 1 Kings chapter 19, well mentioned. If you read that, I often quote this example when we talk about how people go through mental problems and how we should manage them. The perfect psychologist God was. Elijah on Mount Carmel, he defeated the prophets of Baal. There were hundreds of prophets of Baal. He defeated all of them. And in God's name, he was the victor. But immediately after that mountaintop experience, he became terribly depressed, valley experience. And he came down and he said, I don't want to live. I would rather die, and became so depressed. And he ran for 40 days without food and fluid. And it's, what God did? That's a perfect psychologist. God did not tell him, hey, why, Elijah, what are you saying all this? You're supposed to be a prophet, and you're saying you want to die, and you're saying it's not worth living anymore. What kind of a prophet are you? Never did God mention. This is what we often do to others. God never did that. You know what God did? God knew that Elijah was exhausted, tired, the reason for some of his depression. He let him sleep. Then he woke him up and fed him. Then he let him sleep again, woke him up and fed him, knowing that his physical needs were priority at that time. Then he took him to a mountainside, and there he started his psychological treatment. He never condemned Elijah, but what he did, a good example for us, we'll come to that later, asked questions. Elijah, why are you here? Elijah, why are you feeling like this? Never condemning him, but asking him questions. And that's very often what we should be doing. We are going to be fellow travelers with people who are going through mental illnesses. And Elijah was then recommissioned, not condemned, to appoint a king and to appoint his successor. Job's, I told you already about his emotional pain and grief in the book of Job. Job acknowledged what he was going through and expressed it to God. God is bigger than all this. He can take all these things that we throw at him. Yeah. King David's emotional suffering in Psalm 38. Read Psalm 38. I often say, if you want to know the symptoms and signs of a melancholic depression, what we call a major depression, read Psalm 38, where he talks about the aches in his muscles and bones and, all the things he was going through. A good example of depression. Psalms of lament. There are 65 psalms written by different people lamenting what they're going through. King Nebuchadnezzar's insanity. We all know in Daniel 4 how he became proud after building his kingdom. He looked at and he said, oh, what a great man I am. God struck him down. And if you read what happened to him, he became insane. and he was on his all fours, his hair grew, he was eating on all fours the dew from the ground, just like what sometimes we find schizophrenics on the road in some of the Indian towns. Not many these days, but used to. Seen so many of them, with their rags torn, going into all kinds of things, eating food that is left over, hair grown, nails grown. That was how King Nebuchadnezzar was. After 7 years, it says, his sanity returned. Jesus' emotional grief at the death of Lazarus. Jesus wept. Remember that. His emotional pain and suffering. When he was supposed to die, it says Jesus sweated blood. That's how much of suffering he went through. And in Gethsemane, what happened? So examples from Bible. Believers struggle too. Many examples. Many Christians suffer from mental illness at some time in their lives. If we are honest, all of us have gone through different depressions, anxiety. William Cowper, the famous hymn writer who wrote There's a Fountain Filled with Blood, had several episodes of severe depression and was suicidal to the point of wanting to kill himself. Many hymns that he has written. Charles Spurgeon, the famous theologian, writer, struggled with depression. Others that have struggled with mental illnesses, Martin Luther, John Calvin, John Wesley, C.S. Lewis, Isaac Newton, all these people struggled. So in conclusion, Christians have caused a sense of guilt among many Christians suffering from mental illness and emotional problems. Most of the confusion among Christians is due to ignorance and wrong teaching, interpretation of the Bible. Teaching that communicates the message, intentional or not, that Christians don't have serious problems. Teaching perpetuating misunderstanding, mistrust of psychology and psychiatry. You should never go and see a psychiatrist. They are all, secular people, their way they're thinking. Teaching that suggests that mental illness is God's punishment. Teaching that claims mental illness is evidence of weak faith or sin. Teaching that proposes purely spiritual solutions to medical problems. Don't minimize the severity of mental illness. It is a sad and it can be a severe illness in many patients. Don't question the validity of specific diagnosis. Many people will die, oh, what is anxiety? Really? Is there such a thing as that? Don't question the legitimacy of treatments dispensed by professionals. You shouldn't have taken that treatment. You should, just pray more or read your Bible or go to church more. Don't assume that spiritual remedies alone, I'm not saying spiritual remedies are not important, but alone will be the only way that God chooses to heal persons with mental illness. There's a great scope for Christians in the sphere of mental health. Great scope. When I started psychiatry in UK in the 1970s, even in UK, there were very few Christians. But now there are multitudes of Christians who have gone into psychiatry, realizing the great scope that is there. There is even in the Royal College of Psychiatrists a special division of Christian psychiatrists. So there is a great scope. Now, the biggest single factor for success, when you look at, there are so many different kinds of psychological therapies. Those who know about psychiatry and psychology know there's so many: CBT, psychoanalytic psychotherapy, desensitization, relaxation, many types of psychological therapies. But when they have done research, what has been found? That it is not the type of psychotherapy or psychological therapy that makes a difference. It is the therapist at the end of the day, the relationship that is built, and the therapist that is the biggest factor in being successful in treating a patient. So remember, we as Christians, we believe that the Holy Spirit is indwelt in us. And in every transaction with other human being, not only us, but the Holy Spirit is being involved. And what a great gift we have. Christians pioneered the 19th century reformed regarding care of the mentally ill. In a post-Christian world, like what we are living now, we say in the West, there are less and less Christians. We have great challenges, but at the same time, great opportunities. Now, we don't have time, unfortunately, and we don't have the scope, but I would like you to look at these questions. Maybe in your own time, we can look at it, think about it, and it'd be good to reflect, not only hearing what people say, but reflecting ourselves. Am I a head or heart-oriented person? We are all different in the way we are. How does this affect how I relate to believers experiencing mental illness? How does my own upbringing, background affect my view of the origin of mental illness? Where did I learn these attributes from? What informed the development of these beliefs? Do I feel uncomfortable when speaking to distressed people? And if so, why? Why do I feel distressed? I can speak to somebody who has got, a physical illness, okay, with cancer, but why do I feel uncomfortable when I'm speaking to somebody who's depressed or anxious, or is a schizophrenic or a bipolar affective disorder? Do I avoid people like that from suffering from mental illness? And the question then is, if we do, why? What are the messages and signals that we send out to people like that? Or do I regularly seek out people who need help? That also can be, some people are always wanting to go out and help. That might be something, a problem in our personality. We are trying to be fulfilling gaps in our life. Is this primarily because I desire to meet their needs or my own needs? Do I continually feel the need to solve their problems? Do I frequently find spiritual explanations for someone's illness? Am I ever judgmental, jumping to conclusions about why someone is experiencing such difficulties? So these are questions. If we had groups, we could have looked at it. And a case study. James is a 20-year-old man who reports that he feels depressed and is expressing a significant amount of stress about college. He spends much of his day in his room playing video games. He rarely attends classes and has little interest in anything else. James describes himself as a shy person and his very small group of friends from his school days. His level of stress has amplified since college. He feels that people find him boring or a loser. When he loses his concentration, he stutters, is at a loss of words, starts to sweat, which only makes him more uneasy. Since starting college, he has been isolating more, turning down invitations from his roommate to go out to eat or hang out with friends. He is also ignoring his mobile phone when it rings. That's one case. Priya. Priya is a 19-year-old female complaining of crying spells, feeling sad all the time, has trouble sleeping at night, has poor appetite with weight loss. She reported that her sleeping was disturbed in that it frequently took her several hours to fall asleep, that some nights she could not fall asleep at all, and if she did, she slept for only a few hours. She stated that she spent the time awake thinking and worrying. She acknowledged that some of her worries included thoughts that she was not a good daughter and that she felt she was a problem to her parents. She reported that she thought about her family of origin and an unsatisfactory relationship with her mother. Discussion questions. Again, if you had groups, would you notice people like this in your church or in your EU group or EMFI group? How do people view or relate to people like this? And why do you think this is the case? What challenges would church or your fellowship present for these people if they came to your fellowship group? Do you think these people have a mental health problem? If so, what kind of a problem? What reactions might people in the church have to how these people behave if they respond to what they saw on the outside without considering the complex factors that underlie what is seen? So those are questions we could have done. I mean, unfortunately, we don't. So I'm happy. If you have questions, you can write it out in the question Q&A box or chat box, and I'm happy to take those questions during our times of discussion. But let me go on to this, and then we can have a break. Recognizing mental illness. If you find somebody who has changes or abnormalities in personal care, speech, behavior, or emotion, these may impact sleep, appetite, activities, relationships, and comments made that might be an indicator of a mental illness. Diminish or poor performance in school, work interest. That might be an indicator of mental illness. Increase interpersonal difficulties or isolation. It could be an indicator that somebody is going through a mental illness problem. Use or abuse of substances like drugs, alcohol, or even food. Some people use food when they are depressed, anxious, to satisfy. Increase screen activity could be an indicator all the time in front. And we know, let me say that, there are more and more studies, even today I read, that is showing that young people who are spending a lot of time on mobile phones and screen activity are becoming more and more psychologically unwell and stressed. This is something that we really need to be very careful about. Yeah, in the many of our young people, we don't have time now to interact. In our young days, we used to go out and play with others. These days, there's very little is done, and people spending time on that, and it is not healthy, and it says it's causing. Do you know, in the COVID time in Australia, we have helplines. The COVID helplines were flooded by calls from young people because they were more isolated than saying that I want to die, I'm suicidal. And it has gone on since then. The young people who are tormented and tortured and stressed. Recognizing mental illness. Physical symptoms for which no definite organic cause can be found. Somebody is constantly complaining about their tummy problems, about their aches and pains and palpitation and everything else. All the investigations done, can't find anything. It could be a mental illness. People who claim to hear voices or see things others cannot see or hear, visual hallucinations, auditory hallucinations, that could be an indicator of mental illness. Increased suspiciousness or claiming others are trying to harm them, that could be due to a mental illness. People who have become very cheerful suddenly, say they are rich and claim all kinds of special powers or feel superior. People who are in the manic state, who will be writing checks out to everybody. They're full of life and they think that they can do everything under the sun and become extremely active, etc. Could be a sign of mental illness. People who have become very religious suddenly. Yeah. You know, somebody who is religious, yeah, fine, go to church, read the Bible. But suddenly every topic, recently young man, his father is a head of a mission organization. So I was involved, father was asking for help. This young fellow, everything was spiritual. Everything that was happening, you know, he was telling everybody, you're not praying enough, you're not studying the Bible. His whole life was disrupted with religiosity, and he was having a manic episode. People who are sad, look depressed, and are tearful easily could be a result of mental illness. People who express suicidal thoughts, intent, and attempts could be due to a mental illness. People who claim to be possessed by spirits or being victims of black magic could be a sign of mental illness. Now, how do we respond? I mean, I know there's a lot of things I'm talking about, you know, and without any breaks. I'm sorry about that, but so that we can, the challenge within the church is how to respond effectively and with credibility. Be willing to accept that none of us is perfect and that we are all vulnerable to mental and emotional problems. Be willing to accept that we are all fallible and we do not have all the answers. But we, at the same time, we should know our limitations. We are going to try and help people who are going through mental health problems. Be willing to work with mental health practitioners, even those who are non-Christians. How do we work with people like that? Sympathy, empathy, compassion. We need empathy. I don't want to go into, as I can go on talking for hours on all this, the difference between sympathy, empathy, and compassion. Empathy is feeling, not just feeling sorry, but feeling the way that person feels. And as Christians, we are asked even to go more than empathy, the way Jesus did. He didn't just feel the empathy, but he did something about it. Need to be moved with compassion the way Jesus was. Another S, support, prayer, emotional and practical support with the person and family. We all, as human beings, need affirmation. 4 A's: acceptance, affection, appreciation. As I said, I can talk about each one of these and spend a lot of time, but we don't have the time, so I'm going through quickly. Another S: speak little, but listen much. Remember what I said? God asked questions. Listening is hearing with understanding. Be careful of non-verbal cues that we give and wise use of questions that we ask, open-ended questions. People can pick up non-verbal cues. As you all know, communication, 60% is non-verbal. It's not the words that we use. You're asking somebody, how are you? And you're looking everywhere else in the church. Person immediately knows you're not really interested. Subjectivism: encourage person to move from subjective feelings to objective truths, including biblical truths. We need to understand and distinguish the difference between symptoms and the cause. We might look at a person and say, oh, he's an angry person. That is the symptom. But why is he like that? That's the cause, to try and understand what is causing the symptom that we are seeing. Self-esteem, very important. I can do a whole topic on self-esteem. Secrecy. So when we are trying to deal with people like that, it is important to respect privacy and confidentiality. Be careful of sanctified gossip. What do I mean by sanctified gossip? Somebody tells you something, in confidence, then you go and tell somebody else and say, hey, I'm telling you this so you can pray about this person. We immediately broken that person's confidence. That's why I'm saying sanctified gossip. We think we are doing it for the right reason, but it is already breaking the person's confidentially. Remember, another S: mental illness takes much longer for recovery, and there are often relapses. Patience is required when we deal with people with mental illness. Study. Be willing to read and study more like this. As regards mental illness, be balanced, avoid over-spiritualizing. And stigma. Share your learning with the church, what you're learning today, and help to reduce stigma and ignorance about mental illness. Now, we won't go into all this because we don't have time. We're not going to break into so when we are discussing about emotional, always be willing to listen, offer sensible advice, be willing to ask questions rather than giving answers. We've gone through that. Support them even if we do not agree within reason. But if somebody is saying, I'm going to suicidal, we can't agree with that. We have to do something about that. So within reason, offer unconditional encouragement and support. We have a saying that many people, we are not all psychiatrists or psychologists. Many people are looking not for solution providers, but what they're looking is for a fellow traveler. What we can be to all of us can be what we call fellow travelers. Maybe not solution providers, but fellow travelers. That's what most human beings are looking for. And we can all be that. So, as I said, we won't go into all this because it takes time. So let me ask you whether you have any questions so far, and then we'll have a break and come back to look at suicide. That's another topic that we'll look at. Any questions, anyone? Dr. Sukumar, is there anything? I haven't looked in the chat.
Sir, good evening. This is Dr. Vemila here.
I will stop sharing the screen and then stop sharing. Yeah.
Good evening, sir. This is Vemila here. So I can see a couple of questions in the chat box.
Yeah.
So one of the questions is, how can we reduce the stigma of mental illness among people? How can we support people of mental illness in the family? I think it's one question gearing towards responsibility of a caregiver.
Yes. So how is the screen still showing? No? I've stopped sharing, isn't it?
We are still seeing, yes.
Oh, you're still seeing it. I thought I stopped sharing. Let me again stop sharing. Why am I not stop sharing? Okay. Okay, I've stopped sharing now, I think. Okay, so the question is, how can we help? So some of the things that I talked about, was about supporting them. So it's really, the last thing that I said is many of the people are looking for fellow travelers that we can walk with them, and be support to them. Many of us are not psychiatrists and professional helpers, but all of us can be fellow travelers. We can walk with them, understand what they're going through. When they need help, we'll say, I will take you to the doctor, or be also supportive to the families that we can do. They are going through stress themselves. When somebody is going through mental illness, we can support the families. We can, as Christians, we can pray, we can keep in touch, we can be in contact with them, and offer whatever help and support we can, as Christians. That's something that we can, all of us can do. As I said, we can all be fellow travelers. Is there anything more specific as to what you're asking?
Yes, so there is another question. It's the person with mental illness is not ready to go to the doctor. So how do we help them
get to the doctor? Now, this is always a challenge, because especially those who are suffering from many of the severe mental illness, psychotic illness, they lack insight, what we call, they don't feel that there's anything wrong with them. And so they are reluctant to go and see. They think, like a manic will say, they feel on top of the world. There's nothing wrong with them. Everybody else is wrong, but there's nothing wrong with them. So that is a challenge. So in India, fortunately, because of the influence of the family and the support of the family, they might finally agree to do that. It is, even then, I can say it's a challenge. But in many Western countries, we have what's called the Mental Health Act, and it is there in India as well, I know, where we can, especially when it becomes life-threatening to the patient or to somebody else, the illness is becoming life-threatening to the patient or somebody else, we can compulsorily take the person for treatment. Under the what's called legally, under the Mental Health Act, we can take them. So that is when they are severely unwell and they have become a danger to themselves or to society, we can do that. But in the other cases, it is really a challenge. And this is where I say it is important, where we need to gain the trust of the person. And so in the beginning, just being with them, listening to them, talking to them, asking the questions, and they begin to develop a trust in you, then they might be more willing to listen to you and say, hey, Priya, I think this is beyond now family help and church help. I think you need to go and see a doctor. Are you willing to? I'm happy to come with you. Will you be willing to do that? And then at that point, some people might be willing to, others would still be reluctant. And that I recognize is always a challenge when it comes to mental illness.
So there's another question which says, how does faith influence the treatment?
How does faith influence the treatment? As I mentioned in passing, I don't know whether you took it, it has been found that faith does not prevent a person from falling mentally ill. However much faith we have, if we are going to, it's not going to stop us from falling depressed if things happen, or schizophrenia or bipolar or whatever. But faith helps, what has been found, in recovery. So someone who has a faith, because they have God, because they have community that support them, because they can pray, and because of that faith, that appears, research has shown, person who has faith helps in the person's recovery. They can recover a bit quicker and faster than a person who does not have faith. So that's what has been found.
So there's another, thank you, sir. There's another question. How long will be something like incubation period? Like early cancer detection is curable, but before mental illness becomes chronic and tough to cure, what is the time? So basically, they are asking about is mental illness curable, and does chronic mental illness become difficult to cure?
Yeah. So just like physical illnesses, there are many physical illnesses, as you know, that can become chronic, and we only can symptomatically treat them, not cure them, whether it is arthritis or whether it is cancer or many, many, many illnesses. Similarly, there are mental illnesses that we can cure with psychological therapies and psychotherapies and chemical biological treatments. We can treat them. I've seen many patients who do recover fully. Others might take more time, and some others, the symptoms might be relieved to some extent, but the illness goes on. So I'm saying that happens in mental illness similar to what it happens in physical illnesses as well. So there's a whole spread. It is not that all mental illness fall in the same category. There's a wide category of mental illnesses.
Thank you so much, sir. There's another question that we have got from YouTube. How to support a person with chronic depression, especially the person does not want to do any activity and is gaining weight?
Yeah, well, again, as I mentioned, it is often difficult to change. I mean, if the person is having a depressive illness, then certainly that person needs treatment. It could be medication, it could be psychotherapy. See, the problem with the term depression, there's a lot of confusion with the term depression. The term depression, the same term depression is used for a mood state. We say, oh, I am sad or depressed. It's a mood state. It can be a symptom of an illness. We say the person has got depression is a symptom of one of the psychiatric illnesses. And the same term is also used for an illness, depressive illness. So when we say a person is depressed, are we meaning a mood state the person is having? Is it a symptom of another illness that the person is having, or are we talking about illness? So this often causes a lot of confusion, unfortunately, the term depression. So if a person is suffering from a depressive illness, again, there are different types of depression. There is what we call melancholic depression, or what we used to call endogenous depression. So that is where they have severe symptoms of depression, where they have psychomotor agitation or retardation. They have got loss of appetite, loss of weight. They have sleep disturbance with early morning awakening. So they have suicidal thoughts. So these are the severe depressive disorders. And my experience has been those patients who are severe actually respond much better to treatment with physical treatments. That means with medication, antidepressants, and sometimes even ECT that they require. They do well with that. But it is those who probably have what we call what we used to call neurotic depression, what we call stress-induced depression, that can sometimes go on and on and on. And that is because they continue to have the stress factors, things that are happening in their life, which are continuing to cause stress and distress for them. You see, today I was talking at a group. I was saying, we have stages of stress. We have stress, which is normal for all of us. Every human being faces stress. That is normal. We all have stress, and stress can be positive. Only if we have stress are we going to, as students, sit down and study for exams. If we don't have stress, we're not going to do that. But when it goes on chronically and becomes too much, stress becomes distress. It's when it becomes distress that it becomes a problem. And if distress goes on for too long, what happens? It ends up with disease. So remember, stress, distress, then it becomes disease. So when we're talking about depression as a result of stress, are we talking about distress that has happened because of stress, or is it a disease, a depressive disorder? So if it's a depressive disorder, we can try and treat with medication. But if it is this chronic stress that is causing distress or depression, then the important thing is to take care of the stress factors that are happening. whatever they are, that is more important very often. And that's why we say things like that, they need more psychological treatments rather than medication to help them better.
Thank you so much, sir, for answering all the questions. While you were sharing about treatment, you did share about ECT. I think
ECT.
that, there are so many people who are very apprehensive about ECT, and would you like to give some insight into what it is for those who might have to take a decision for their loved ones, whether they have to accept the doctor's advice about ECT or not?
Yep. So ECT, unfortunately, at one time was given too much. We know that, for every psychiatric disorder, because we didn't have many other treatments. So any psychotic disorder, schizophrenia, manic disorder, depression, ECT. So that is why it has fallen into disrepute in many places. But it is coming back now. People have realized that there is a place for ECT if the patients are chosen well. And I've given a lot of ECTs in my specialty, geriatric psychiatry. Many of the patients that fall severely depressed are really what we call melancholic depression, and they do very well with ECT. So there is a place for ECT. That is, if we choose patients well, I would say that most of the patients that I have chosen well for ECT have all recovered, right? Very rare patients who do not recover. So there is a place, but it is choosing the right patients for ECT. It is not a panacea for all mental illnesses, but when patients are chosen well, especially patients with severe melancholic depression, mania sometimes, which is not responding to anything, and depression that is result from mania, what we call manic depressive psychosis, the depression that very often happens as a result of mania, they respond very well. So this is choosing the patients that is important. And we don't now randomly give it to all people with schizophrenia and all that, very rarely. But it is mainly depression, bipolar affective disorders that they do very well. Not all kinds of depression. Remember, again, the more severe, what's called melancholic depression.
Thank you so much, sir. Sir, one more question. You, in your talk, have mentioned that during COVID, during COVID, the calls from young people, probably because of isolation and being locked down, have increased, and it continued. So can you throw some light into why it is continuing and how we can prevent mental health issues among young people?
Yes, well, I'm not a specialist about adolescent and child psychiatry. That's not my specialty, but there's so much being written about this. As I said, one of the main factors is that was the social isolation that happened at that time, and children were just stuck at home, and that caused a lot of distress. And even after what unfortunately has happened after the COVID releasing is many people have still very reluctant to mix and be in relationships. And the focus that has happened, as I'm saying, there's so much written now. I would encourage you to read and studies that have been done, which shows the harm that social media is doing to children. And they're getting all kinds of influences from the social media, all kinds of things that they read and then they emulate that is being done from social media, which is impacting the mind of children. They should really be out there playing, physical activity, relationships. In many of the illnesses and mental illness, one major thing as a corrective factor is relationships. That's why I'm saying about, God has created us to be in relationships, support of people, community, church, family is absolutely important when we talk about recovery. Yeah. So that's one of the reasons, Sister, why, Sister Vanilla, why there's ongoing stress and distress among children following that.
Thank you so much, sir. Would you like to add something about digital detox, or how it's not just among young people and teenagers, but it's also among the elderly and older people, the social media addiction and excessive use of digital media?
Oh, yeah, yeah. I don't have to add. I think we all probably know the harm that it's doing. I mean, it is cutting back. I mean, you can see young people walking the streets, they're on their phone. I heard a story recently. A father was going with a daughter shopping, and she was on the phone all the time, and she was chatting away with a friend. And the father said, what are you on what are you on this phone? Who are you chatting to?" And she said, "I'm chatting to my friend." And he said, "Well, your friend just walked by, so passed by, and so she even missed a friend who was walking by because she was so engrossed on the phone trying to chat to this friend of us. So that's how we have this modern day society has become, and we get all our information from social media, and it is not very healthy. We know that, and it is doing things on our mind. Even politically it is doing that, socially it is doing that, and media knows. That's why they spend so much of money, because they know how influential it can be in our lives. So let us be careful. I mean, we got so many good books and Bible and other things that we can read and get our information from, rather than from social media. I hope we can take that to heed. Yeah.
Thank you, sir. Thank you so much. If there are no more questions, maybe we can.
Have a break.
Yes, sir. We can
Yeah.
take it. Thank you so much for your patient answer.
So shall we have a break for how long? You think about 20 minutes or so, for people to have something to eat, drink, toilet, and then come back? Is that fair enough, or what do you think? And then we'll look at suicide a bit
Yes.
more.
I think that should be fine.
Okay. All right. We'll try and get back by 7:25 or whatever. Is it 5:07 now? I think we need to have a break when we are on Zoom too long. We can't concentrate. Okay.
Sure, sir. So at what time we'll meet again? 7:25.
Is that all right?
Yeah.
7:20, 7:25? What do you think?
Yeah, that should be okay.
Yeah. All right. Let's do that.
Yeah.
Thank you, sir. So we'll be back
Welcome.
in 20 minutes by 7.
Mm.
Mhm. Sir, can you please stop your screen sharing? I think
Oh,
you
am I
stopped.
still sharing
No,
the
no,
screen?
you stopped, I think. Yeah,
Yeah,
that's
I think I've stopped. I'll just put up the next one so that when we are ready, we can share the screen.
I'll share my screen, sir, just to
Yes, please do.
inform them about the time. I know about the next session. So,
Please do.
Yeah, friends, welcome back. Thank you for joining. Vanilla, over to you. Please take it forward.
Welcome back, everyone. We are so privileged to have Kuruvilla George sir with us, expert in this field and a veteran in this field. Sir, over to you. Now we're going to have another session about suicide. And as the session is going on, please post your questions as and when. And at the end, we'll again ask sir those questions and find the answers. Over to you, sir. Thank you.
Thank you. Thank you, Mr. Vanilla. So I'm going to share the screen. So, yeah, so just like we looked at mental health, this is our Christian perspective, mainly on suicide. So as an introduction, what do we know about suicide? First of all, there are many people in the world, just I told you about Christians in the previous session who have gone through severe depression and suicidal ideas, many biblical characters who felt suicidal. So many people experience suicidal ideation at some point in their life. And many of us, if we reflect on our life, there were times when we think life is too much for us. Maybe we never came to the point of being suicidal, but I've thought, what's the point of going on? Many people have gone through that phases in their life. So what we're going to look at is, what is suicide? Who and why? Why do people commit suicide, and who are the people who are more prone? Some theological aspects, and our response as Christians, and a bit about suicide prevention. So suicide, what is it? The term suicide is derived from Latin, from the word called suicidum. That's where the term has come from Latin. And suicide, the definition is any death caused by injuring oneself with the intent to die. Now, that is important. Some people have injured themselves, but not with the intent to die. It might be for some other reasons that they have injured themselves, or cut themselves, or taken tablets, but not with the intent that I want to die and go off the earth. So this is important. Suicide is any death caused by injuring oneself with the intent to die. There are three aspects, therefore, when we look at that definition. First, it is a self-inflicted injury. Second, there is the intention to die. And thirdly, when you say it's suicide, it results in death. The person does then end up in death. And that's when we say it's a suicide. There are also other terms that we use. For example, what's called attempted suicide, or para-suicide is what we used to say. When I was studying, we used to say para-suicide, but we don't use that word very much now. We call it attempted suicide. That is when someone harms themselves with an intent to end their life, but does not die. So they might have the intention, but either they have been, the overdose they took was not as severe for them to die, or they were saved by their relative, or by paramedical, or whoever, police. So they ultimately do not die. So that we call attempted suicide. Self-harm could occur with the intent to die or not to die, as I was mentioning. Some people do it for many reasons: attention seeking, because they're so distressed. Some people find that cutting themselves takes the distress away from them, whatever. Then we also increasingly, I'm sure you've heard of this term, physician-assisted suicide, kind of euthanasia, where the physician has helped the person to end their life. So we call it PAS, or physician-assisted suicide. Then, see, this is where it becomes confusing. We have all heard of martyrdom, when people, for a cause, political cause, a religious cause, have sacrificed their life or taken their life. Now, is that suicide? It's a good question. Do we call martyrs as suicide? Because they knew that they were going to probably end in death, what they were doing or what they were believing. So do we call that suicide? Something to reflect. Harikiri, I'm sure many of you might probably have heard, during the Second World War, Japanese soldiers and the sailors, and especially Air Force people used to go and kill themselves so that by their killing, many others of their enemies would die. Harikiri. Sati happened in India. I don't know how much of it is happening these days, but as you know, in the past, when the husband dies, the widower used to then feel that the pressure to be on the funeral pyre and kill herself after that. Sati. Now, is that suicide? A question to think about. So these are all different terms that are used. Suicide. What is suicide? Suicidal thinking and suicide are a lot more common than we think. We only often think about somebody who has ended up their life with that, but it is more common than we think. If we are honest and ask people, there are many, many out there in society who have at some time or in their life thought about the pointlessness of living, and maybe it's better to die. In the World Health Organization have reported, and usually when it comes to suicide, it's often underreported. For example, in a road traffic accident, somebody dies. Do we know whether it was because unintentionally they ended dead because of the road accident, or did they intentionally go and get into the accident so that they would die? Very difficult to say once a person is dead. So it is always underreported. But the World Health Organization have stated in their statistics that 800,000 people die by suicide every year. And 77% of global suicides happen in low and middle income countries like India. So 77% of all global suicides happen in a country like India, many of the South Asian countries, Bangladesh, India, Pakistan, Sri Lanka, Nepal, and many African countries in the middle and low income countries. World Health Organization also have stated for every war death, for example, now we have the Ukrainian war with Russia, and we hear about all the people who are dying. The Palestinian war that's going on, we hear about all the deaths that are happening. But statistics show, and the World Health Organization report, that for every war death, there are 3 homicides, that where people kill each other, homicide deaths, and 5 suicide deaths. Something for us to take note of. The amount of, we often are horrified by the war deaths or homicides, but suicides are even more prevalent than people dying by suicide, more prevalent than all that. So suicides must be taken seriously, as I've mentioned previously, is usually underreported. What? I'm giving some Australian figures. 8.6 Australians die every day by suicides. That's more than double the road toll. 75% of those who take their own life are males. An unknown number of Australians attempt suicide every year, with some estimates suggesting this figure may be more, maybe over 65,000. Now, I've got Australian figures here, because it was talk given to the Australian, but the other reason is that from India, the statistics is reliable statistics is very difficult to find. So again, this is all about Australian. It's okay. People in rural populations are 2 times more likely to take their life by suicide. And that happens in India as well. In rural populations, many more people, farmers and others, who end up in suicide. Beyond the tragic loss of the person, the impact of suicide deaths are felt by up to 135 people, including family members, work colleagues, friends, first responders at the time of death. So every time a person commits suicide, about 135 other people are impacted by that action, including family members, work colleagues, friends, if it is Christians, church colleagues, that are devastated by what happens. Now, we don't often think about these men at the two end of life spectrum. Young males and the older men are the most vulnerable to completed suicides. We often think about females committing suicide, but females, there are more attempted suicides, more taking poisons or whatever, insecticides or whatever. But when men do it, they seem to do it properly. They either hang themselves or shoot themselves or drown themselves. The way that they commit suicide, they end up being completed suicides. So we often know about young males, but remember this, males aged 85 and older have the highest rate of suicide. And let me also tell you this data that is there. Again, it's very difficult, as I said, about India, but it says 40% of all female suicides in the world happen in India. 40% of all female suicides in the world happen in India. And why is that? Well, we know that there's more abuse, domestic violence, rape, dowry deaths, so much more suicides. 40% of all female suicides happen in India. Females attempt suicide, males, as I mentioned, end up in completed suicide. Age, younger males and older males, the two ends of the male spectrum are more vulnerable. Race, higher incidence in some cultural groups. There are more, as I said, in lower economic social classes, in the villages, so higher incidence in some cultural groups. Religion, in times past, there was lower suicide rates in some of the very conservative and traditional Christian communities because suicide was not so well accepted, for example, the Roman Catholic countries, but that is disappearing now. Occupation, we know that some occupational are much more vulnerable. For example, we are all involved with the medical profession. It is well known that doctors have a high rate of suicide. And among the doctors, it is often anesthetists and psychiatrists who are supposed to have high suicide rates. So there are occupational hazards. Farmers, because of their often, because of the weather changes, they have 1 year good harvest, then the next few years they got terrible harvest, they come into financial disasters. Farmers, there's a high rate that you find occupationally of suicide. Economic status, I told you there's a lower socioeconomic. There's someone who needs to mute their mic, please. Someone who can mute their mic because we can hear what's going on. Economic status. And then surveys. In USA, it says for every 14 suicides per 100,000, approximately 500 people attempt suicide and 3,000 people think about ending their life. Isn't that amazing? Something for us to reflect. For every 14 suicides per 100,000, approximately 500 people attempt suicide. It doesn't end up in completed suicide, but attempt suicide, and 3,000 people think about ending their life. Therefore, there's a significant chance that suicidal thinking occurs in your family, in your church, circle of friends, and even your faith community. Even among students that you are with, even in our EMFI community, there would be. There's a good chance that there are people who have been thinking about ending their life. So why? Why does this happen? Suicide is never the result of a single factor or event, but results from a complex interaction of many factors. And it usually involves a history of psychological and social problems that are happening. This is something from the Center for Disease Control from USA that says that. It's not a single factor, but complex interaction of many factors. Why? Normal people, I said, do go through times like that. People with mental health disorders are much more vulnerable to suicide. people with bipolar affective disorders, major severe depression, schizophrenia, much more vulnerable. People with physical health issues are more vulnerable. We find in the elderly, I'm a geriatric psychiatrist, many people who attempt suicide, it's because they've got chronic health problems, chronic pain, chronic disability, and then they feel life is not worth living going on like this, and better for me to be dead, and then they commit suicide. Relationship problems, especially things, as I mentioned already, in India, domestic violence, and then ends up in suicide. Many, those who work in rural areas, you can, wives and partners who have come after taking all kinds of substances because of domestic violence and domestic abuse. Unemployment, financial problems, homelessness can result in people feeling that life is not worth living anymore. Social isolation, this is another factor very often seen in elderly people. They are now on their own, and unfortunately, it's happening now in India, especially in Kerala, so many places, homes where an old person is all by themselves in their home. Children are away in America or Australia or wherever, or Middle East, and they feel socially isolated. What's the point? I'm on my own, might as well be dead. Alcohol, drug abuse, a common factor for suicide. Childhood sexual abuse, leading to post-traumatic stress syndrome, which goes on, and the results of childhood sexual abuse is terrible for many people. Losses and failures in life, educational failures, again in India, you don't do well in exams, the people think low of you, the parents then look down, and people feel there's no point in living. Identification with others, many young people, a friend is committed suicide in school, they identify with them. Forced immigration, access to poison. So those people who have more access to poison, that's why farmers, for example, they have more insecticides, pesticides, trying to contain things in their farms, the more access to it. Firearms, because they have more access to guns and other things, and also access to medications leading to overdose. That's why we have to be careful about people who accumulate a lot of prescribed medications. So here's a story. Again, we don't have much time to have, possibly have breakout sessions, but just listen to the story of Mary. Mary is a 20-year-old young woman who accepted the Lord as her savior a few months ago due to the testimony and friendship of Amy, who is a committed Christian. Both women have had traumatic backgrounds with a history of sexual abuse as children. Amy is a Christian and a regular church goer with a good network of Christian friends and support. She has been working with a support group for sexual abuse victims, and that's how she got to know and developed a friendship with Mary. Mary has been finding it very difficult to get past the memories and trauma of a sexual abuse. She is suffering from post-traumatic stress disorder and has frequent flashbacks. She's attempted self-harm and suicide several times in the past, but not after becoming a Christian. However, more recently, after coming in contact with the individual who used to abuse her, all her memories and trauma came back, and she sadly took a serious overdose of her antidepressant medication, leading to death. Story of Mary, how tragic. And this could be somebody that you know in your church, in your group. Story of Thomas. Thomas is an 86-year-old gentleman who is living on his own. His wife passed away a year ago after suffering from cancer for a number of years. Thomas was the main carer, though they had family who came to assist when they were able. Thomas is also suffering from arthritis, which causes a lot of pain and discomfort. Though a committed Christian whose faith has been very important for him in the ups and downs of his life, he became very depressed following his wife's passing. He began to have psychotic symptoms with delusions that he's a bad person who has committed an unforgivable sin because he did not pray enough for his wife's healing. Thomas also began to hear voices telling him that he would be better off dead and be with his wife in heaven. He sadly also took his life by sitting in his car with a tube from the car exhaust. Another tragic story. So, discussion questions, but you can reflect on your own. What is your perspective on suicide? Now, this is an important question, and we will come to that next, some theological perspectives. But if you're going to help someone who is suicidal, who is feeling that life is not worth living, it is important for us to have a personal perspective on suicide. What do we think about suicide? What about do we think about people who attempt suicide? What is the way we view it? Because the way we think about suicide and suicidal persons will come across to that person if we are trying to help that person. Whether we like it or not, our perspective contaminates the way that we will deal with them and try to help them. So it's an important question. What is your perspective on suicide? Is it sin? Is it a forgivable sin? Is it an unforgivable sin? What is your perspective? There you are. Is suicide sin? What do you think about Christians who become suicidal? What does the Bible say about suicide? Again, it would have been good for us to, as a little groups, think about this, hear our views, have some discussion. But I'll give you, because we are all on our own, just a few minutes, just to think about these questions before we go to the next part. What is your perspective? Is suicide sin? What do you think about Christians who become suicidal? Do you think negatively about them? Do you think they are weak Christians? Do you condemn them? What is your view? All right, let's go further and look at what the Bible has to say about suicides. That was one of the questions. What do you think the Bible has to say about suicides? In the Bible, there are examples of completed suicides. And here are the examples of people who committed suicide in the Bible. One is King Abimelech. And we can read about King Abimelech in Judges chapter 9, verse 54. That's it. Because we don't have time to read all these Bible verses, please take it down and read it for yourself. King Abimelech killed himself. The next person is Samson in Judges chapter 16, verse 30. And we all probably know this story from Sunday school. Samson was caught by the Palestinians. His eyes were gouged out. Finally, he was tied to the pillars of this great hall where all the Jewish leaders, scribes, Pharisees, Sadducees were there, laughing at him. And what did he do? He pulled the pillars down, killed lots of them and himself. King Saul, in 1 Samuel chapter 31, verse 4, he said that when he was at war, he was injured, and he asked his armor bearer, I can't go on like this. I'm the king. I'm fatally wounded. Please will you kill me? The armor bearer refused to do that, to use the sword, Paul's sword, and kill Saul. So Saul fell on his own sword and killed himself. Then when the Saul's armor bearer saw what happened to King Saul, the armor bearer also killed himself. That's number 4. 1 Samuel chapter 31, verse 5. Ahithophel, in 2 Samuel chapter 17, verse 23, it talks about Ahithophel committing suicide when he was one of the court's wise men, but when his wisdom and his advice was not taken, he went home and committed suicide. King Zimri, another king, in 1 Kings chapter 16, verse 18, committed suicide. And the 7th, so 7 examples in the Bible that we can read of completed suicides. And there's only one in the New Testament, and we all know that, and that's Judas, who went and hanged himself. Matthew chapter 27, verse 5, when he saw that Jesus was taken away prisoner. So that's completed suicides. In the Bible, there are also 8 examples of people who contemplated suicides. They didn't end up in suicide, but they thought of suicide. And who are they? Rebecca, in Genesis chapter 27, 46, she felt suicidal. I'm not going to have any babies, might as well be dead. That is Genesis 27, 46. Rachel, in Genesis chapter 30, verse 1. Many of these well-known biblical figures felt suicidal. Moses, in Numbers chapter 11, verse 15, he told God, I might as well be dead. We talked about Elijah. Elijah felt that life was not worth living. 1 Kings chapter 19, verse 4. Number 5, Job. Job said, brother shouldn't have even be born. So Job chapter 3, verse 20, he felt suicidal. Jonah, when his message was not heard, he went under a tree that had shade. At the when shade, felt life is not worth living anymore. So Jonah. Jeremiah, in Jeremiah chapter 20, verse 18, talks about feeling suicidal. And New Testament, again, there's only one example, and that's the Philippian jailer that we read in Acts chapter 16, verse 27 and 28, when Peter was there in the jail, and or was it Paul? Sorry, there was an earthquake, and the jailer thought all the prisoners were going to escape after the earthquake because the chains were released, and he was going to kill himself. And then Paul said, don't, we are all here. And then he and his family were converted and took baptism. That's the only mention in the New Testament of somebody who felt suicidal. 8 examples mentioned in the Bible of contemplated suicides. So let's look at the theology. Sorry, I'm just getting up because my computer charge is going. That's better. Christians hold a spectrum of beliefs about suicide. And as I mentioned before, it is important for us as individuals, especially many of us in the health profession. We're going to come across people like that. We're also going to come across people in our churches, our circle of friends and society. It is important for us to have a view of suicide as our theology affects what we do and our response as Christians. If we want to be helping others, it is important. The research finding about is that pastors, when they have done a research among pastors who deal with people like this, that many pastors are struggling in this area with the paradox of telling people suicide is a sin versus talking about God's mercy to loved ones. Somebody has committed suicide, the family are grieving. What do you tell them? Oh, they've gone to hell? Is that what the message many of the family members want to hear? So this is a paradox that the pastors, many people in that leadership positions are struggling. How do we deal with that? We tell suicide is sin, and then when somebody in the church dies, so how do we deal with the grieving family and friends, etc.? What's the message we give them? Does God love the person who has committed suicide? Has God mercy to loved ones? What is it? It's researchers finding that it's a great struggle for many pastors. This complexity and resulting confusion and uncertainty and discouragement, along with the lack of understanding of what the Bible says or does not say, has kept most religious communities from addressing suicide with the urgency and careful attention it deserves in the midst of today's crisis. We can read that again. Very telling statement by J.T. Clements. This complexity and resulting confusion, uncertainty, and discouragement, along with a lack of understanding of what the Bible says or does not say, has kept most religious communities from addressing suicide with the urgency and careful attention it deserves in the midst of today's crisis. So when we look at theological perspectives, we're going to look at it from a few points. One is view that suicide is a sin. View that suicide is not a sin. That is one theological perspective, that suicide is not sin. Why? Because the person who is committing suicide often has diminished responsibility. They do not know what they are doing. They're suffering from a severe mental illness. They are taking an action that they can't be responsible for. The person is a victim of insanity or demonic possession, unable to make a rational decision. So this is one of the reasons why people who take that position say suicide is not a sin. And that was, we know, the well-known theologian Martin Luther, his position. He said, first of all, because the Bible is silent, nowhere in the Bible does it mention, so suicide is mentioned 7 times in the Bible, as I've already shown you, the 7 examples of suicide in the Bible, but none of the narratives condemn it. It just says the person committed suicide, but the Bible doesn't say they did anything wrong. So suicide is mentioned 7 times, but none of the narratives condemn it. Early church is silent. So in early church history, did not offer any opposition to suicide before the 3rd century. So before the 3rd century, there was no opposition. All the opposition actually came after the 3rd century. Many Christians in the early church, as we all know, many Christians were martyred in the early church. And this is the interesting thing, is I talked about earlier. What one person viewed as martyrdom may be viewed by another as suicide. Interesting. So that's the first position that people have. What is that? Suicide is not a sin, and the reasons I've given you. The second position many Christians have is the exact opposite. They view that suicide is sin. And what's the reason for that? They say, Bible silence does not imply approval. Bonhoeffer, another well-known theologian, he argues that the silence of the Bible on suicide is not the basis for condoning suicide. Bible does not always comment on all the sinfulness of acts. There are many things that we do which are not right, but not every sin is mentioned in the Bible. There are many sins which are not mentioned in the Bible. So because Bible is silent, it does not mean it is not a sin. The sixth commandment is also used by these people who believe that suicide is sin by saying, in the sixth commandment, it says, thou shalt not murder. And that was Augustine, another well-known theologian in the early years. Augustine's position was this: since the sixth commandment does not have the qualification, your neighbor, thou shalt not murder, it says. It doesn't say, thou shalt not murder your neighbor. It says, thou shalt not murder. While the ninth and 10th commandment applies to neighbors as well, thou shalt not steal from your neighbor or whatever. But in this case about not murdering, it doesn't say, thou shalt not murder your neighbor. So because of that, what it says is, when you say thou shalt not murder, it applies to others and to ourselves. We should not kill ourselves. And the other argument used by people who believe that suicide is sin is that the sanctity of life. Life is sacred. God has created life. It's only God who has created, only God can take it away. Life is sacred and inviolable. Calvin believed suicide is a sin and wrote, let us wait for the highest commander who sent us into the world to call us out of it. So that's the second position. Suicide is sin. The third view that many Christians have is that suicide is a forgivable sin. Why? Suicide, like any other sin, is like any other sin. Biblically, the only unpardonable sin, as we can read in the Bible, is blasphemy against the Holy Spirit. And the Bible says that, every other sin is forgivable. Only if you blaspheme against the Holy Spirit, that is an unforgivable sin. So we all realize as Christians, all Christians are miserable sinners. You and I am a miserable sinner, equally in needs of God's grace and forgiveness. So all of us are going to eventually die of some unrepentant sin. We have not, every day we have not repented about every sin that we have done, because there are many things that we don't even realize that we have done wrong. So all of us will die with some kind of unrepentant sin or other. Does that mean that we are going to go to hell because of that? Suicide is like any other sin. That's what they're saying. While God clearly condemns sin, he is also merciful and a fair judge. He is a friend of sinners, we read in the Bible. And the other argument that is used by people who believe this, that view that suicide is a forgivable sin, is that the issue of eternal security. And this is a classical Calvinist position, which argue that a Christian who dies by suicide remains secure in salvation. So Calvin says, once you've accepted the Lord as your Savior, you are sealed by the Holy Spirit and you are the child of God. So that a Christian who dies by suicide remains secure in salvation. Mental illness can damage the soul, but cannot destroy the soul, as God is the guardian of our souls. Very interesting. Mental illness can damage the soul, but cannot destroy the soul, because the soul, as God is the guardian of our souls. The fourth view is that exact opposite to the earlier one. Suicide is an unforgivable sin. Why? Damnation to hell follows the unconfessed sin of self-murder. Suicide is the unpardonable sin of blasphemy. Remember what we said? The only unforgivable sin mentioned in the Bible is blasphemy against the Holy Spirit. And people who take this position say suicide is the unpardonable sin of blasphemy against the Holy Spirit. It represents a complete loss of faith in God. And that is a possible Wesleyan Arminian approach. A Christian who commits suicide commits either a sin that remains unconfessed or the sin of apostasy, either of which will result in damnation. So here we are, 4 different views that theologians, many Christians take. The interesting thing is I put those there. What is the view that you have after listening to all these 4 views? Is it a sin? Not a sin? A forgivable sin? Or an unforgivable sin? Something for you to think about, reflect on. And as I said, it would be good and important for us to have a view if you're wanting to help others who are suicidal. So discussion questions, if we had time again. What does the Bible have to say about suicide? Is suicide sin? What we went through before. Has there been any change in the way you think about Christians who attempt or commit suicide? After listening to all this, is there any difference, a change in the way you think about Christians who attempt or commit suicide? And what is your current perspective on suicide? Has there been any change in your perspective? Let me give you a couple of minutes to reflect on that. All right, let's go forward. Theology, false assumptions. Some people have this assumption, real Christians do not experience suicidal thoughts. It's false. Many Christians do experience suicidal thoughts. Suicidal people lack faith and should pray more. Very simplistic view and idea. If we have that idea, let's get rid of that. William Cowper, I mentioned earlier in the mental illness, poet and hymnologist, severe depression and suicidal attempts. Edward J. Carnell contemplated suicide, another well-known theologian at the theological college, actually, contemplated suicide and died from drug overdose. Francis Schaeffer, we've all heard of, theologian, pastor, and founder of L'Abri Fellowship, had suicidal thoughts. Many Christians, if they were honest, talk of times of extreme depression and desperation with thoughts of death. So now we come to a few minutes just thinking, how can we help people when we come across people who are suicidal? What can we do? Again, not as professionals, not as psychiatrists, psychologists, but how can we, a fellow traveler, help somebody with suicide? First thing is, if you do meet somebody who is suicidal or has attempted suicide, his first thing is first aid. We all know first aid in medicine. Ensure the person is out of immediate danger. Once they have attempted suicide, they can't be left on their own after that. When they have just attempted suicide, they need constant supervision until they have had professional help. Remove any means of possible further attempt, either a rope or medications that are there, or a knife, or whatever they have used. Remove it. Any possible means of further attempts. Do an assessment that you can do and refer for professional assistance. Once a person has attempted suicide, studies have shown the risks for further attempt increases each time. And finally, a time will come that they will have a successful suicide. So once we have attempted, we have to be extremely careful. How do we spot warning signs of somebody who is potentially suicidal? What are some of the warning signs? One, they're talking and writing about death or dying. They're often talking, I would rather be dead. What's the point of living? I'm having so much of pain. Every day I feel that life is not worth living anymore. So talking or writing letters to people, their children or their friends or whatever, about same kind of, then that's a warning sign. Look, this person might be suicidal. Threatening about self-harm. Trying to going and getting tablets. So that is another warning sign. Having means of self-harm, hoarding medication, having guns in the harm, whatever, it's be careful. Mental health problems, someone who has got mental health problems that are not getting any better, getting worse, especially depression, they are vulnerable. Be careful. When a person has been started on an antidepressant, this is interesting. People who do psychiatry know this very well. When a person is depressed and severe depression, they have no energy, no motivation. They might think of committing suicide, but they just don't have the energy or, the means mentally to do something about it. But then when they started on antidepressant, the first few weeks are very important because they begin to improve, they get more energy, they're not completely out of their depression. That might be the time they have then sufficient energy and motivation to do self-harm and commit suicide. You find somebody is drinking more and more or taking more and more drugs, might be a warning sign. Someone who withdraws from family and friends, from the faith community, from the church, from EMFI meetings, EU meetings, it might be a sign. Somebody who writes a new will, giving away their possessions. You can take this, I don't want it anymore. How much longer am I going to live? Take these things, giving away to friends and family could be a warning sign. So how do we help? What are some of the questions that we can help people who are going through these thoughts? Have you been feeling depressed? Very often I had to teach medical students when they come through, there's a reluctance to ask this question because they feel if a person is suicidal, by asking the question, you're going to put thoughts into their minds. That is not the case. A person who is feeling that way, when you ask the question, feels relieved very often. Here is somebody who can understand the extent of what I'm feeling and ask that question. They feel relief and be able to say that to you. So it is important to ask, have you had thoughts of self-harm or suicide? And if we don't ask, we might end up in somebody committing suicide. And in psychiatry, there are, we talk about risks. The two main risks are patients who are suicidal and patients who are homicidal that we should not miss. And when they have been feeling like that, can ask the question, when and how often have you had these thoughts about harming yourself or committing suicide? Has it been every day you feel like that, or many times during the day, or is it only once in a while that you have felt that way? It's important to ask. And what have you thought? You just had this thought that might not be worth living, or have you thought further and said, maybe, I should get more medication or do something about this? Have they gone further than just having fleeting thoughts about self-harm? And have you also thought of, many of you have heard of suicide homicide, people who, mothers, for example, who feel that life is not worth living anymore with all this domestic violence and abuse that they are getting. and then they feel I might as well be dead, but there's no point in leaving my little children. Who is going to look after them? And they kill their children as well at the same time. So have you thought of harming someone else? And recent specific thoughts of self-harm have you had? So these are questions that we can ask, and it'd be good if you feel that somebody is suicidal to ask these questions. Don't be reluctant to ask those questions. Have you taken any steps towards self-harm? Have you made any plans for possessions or will? Any thoughts as to how it will affect loved ones? Have you ever thought what you're going to do? How is it going to affect your husband or your wife or your children? Have you been thinking, have you had those kind of thoughts? What is it that has stopped you so far? Is it the thought of your son or a daughter or your husband or wife that has stopped you so far? And what help could make it easier for you to cope? So these are questions we can ask. And how does talking about all this make you feel when you're talking about it? And how can we be good listeners? Suicide is a sensitive personal matter. So we're going to talk to someone, talk privately, not in a public place. Time to make them feel comfortable so that they feel like talking to you. That is important. Be patient and calm. Don't hurry them. Be patient. Reflect on what they're saying. Do not make judgments. This is what I was saying. It is important for us to have a view of suicide. If we come across with a judgmental view, they are going to pick it up. They're going to clam, and they won't talk to you further because they can see from your face, they can see from your responses, they can hear from the reactions, from the words that you use, that you're judging them all the time, and they won't feel like talking to you about it. Accept what they're saying without agreeing or disagreeing. You don't have to agree with them. At the same time, you don't have to disagree. Listen with understanding, with empathy. Listen. Do not discuss whether suicide is right or wrong. This is when they're talking about it, is not the time to talk about theology and say this is what Bible says or doesn't say, and say this is wrong. You terrible feeling you are having. That's not what they want to hear when they are expressing things like that to you. Be non-judgmental. Be empathetic and express empathy. Ask open-ended questions to find out problems, thoughts, and feelings. So, how are you feeling now? Rather than, are you feeling suicidal now? Is how are you feeling now? That's what's called open-ended questions rather than direct questions for them to just say yes or no. So that's an art that we have to learn. Summarize to show that you are listening. So when you're listening to them, say, oh, is this what you're saying? Is this what you said to me? So that immediately shows that you have been listening and you have understood what they are saying when you reflect on what they have been saying. Do not minimize the person's problems or try to reassure statements is, oh, you'll be all right, man. Yeah, don't worry. This is all small things. We all go through it. So minimizing or reassuring statements like that doesn't help when somebody's going through all this. And be careful about our body language, which I mentioned before. You're talking to them and they're looking everywhere else. That shows you're really not interested. You're more interested in what's happening with somebody else or what's happening in the room or whatever. Be careful of our body language. And do not attempt to give the person a diagnosis. Don't be a psychiatrist or a professional person. Oh, you're depressed, man. You need to see a psychiatrist. No. Yes, they need professional help, but don't be giving them the diagnosis. That's not your place. You're a fellow traveler. Try and produce with the person what's called a safety plan. And it prepares the person to cope with the suicidal thoughts. For example, they can themselves they get them to write it. What are the warning signs that you have when you feel like this? How can I make the environment safe? What can I do? Oh, I've got too many tablets. Probably I should keep it locked and give the key to my son or daughter or whatever. How can I make the environment safe so that when I feel like that, I don't easily get hold of the tablets because I know I don't have the key, so I can't get to it. So how can I make the environment safe? identify reasons to leave. So let them write, why should you leave? Why should you not commit suicide? Because I have my family. They are going to get upset if I do this. I have a church. People are very caring of me. Yeah, I'm going to disappoint them if I die. So identify reasons to live. What are things that I can do to cope myself? There are many things out of my control in the world, but what can I do? One or two things that I can do when I feel that way, that I can cope. And who are the people or places I can connect with? When I'm feeling like this, who is the person that I can telephone and call, who will be willing always to listen to me, who will be willing to come, leave everything that they have, come and sit with me? Who are the people or places I can, and who are the people I can talk to? So this is safety plan that they write it out. So it is there for them. When they feel like that, they can look at it and say, oh, this is what I have written. This is what I can do. And how can I get professional help? At the end of the day, that also you should probably say, okay, you feel like this is the number you can call, a suicidal helpline. In Kerala, this is the helpline in Ernakulam. If you look on the website, there are many helplines like that is available in every state that people can call if they are feeling that way. I have seen the number of helplines that are there in India, plenty of them. Then the other thing is refer. If it's a serious suicide attempt, those with persisting suicidal thoughts or history of past attempt, and those with serious mental illness, they need to be referred. It's not something you can help them with. They need professional help. So refer them on. And this is a place where even if the person feels that they don't want to go, they're reluctant to go, we can force them. As I said, people who are going to cause risk to themselves or others, we can take the initiative, call the police or whatever, and get them the help that they need. Encourage person to seek professional help. Find out about assistance available locally. Volunteer to accompany that person to get help. Seek family assistance if a person is refusing assistance. Adolescents need more directive approach. Young people, we have to take control of it. You can't just say, oh, they can make their own decision. If a person has weapons, may need assistance of the police if lives are at risk. Never agree to keep failed suicidal attempt or planned secret. Remember what I said about sanctified gossip and sharing confidential information. This is an area where we can break confidence because the person's life is at risk and maybe other person's life at risk. We need probably to tell the right people about what's going on so that the person can have help. Better for the person to be angry with us than being dead. Remember that. Better for the person to be angry because we have broken the confidentiality than being dead. Later, therapeutic relationship we can form. Regular counseling. Identify issues. Talk to the family members. Discuss alternative to self-harm. Environmental intervention, depression, alcohol, drug abuse. These are all things that we can do after the acute crisis that is over. These are things that we can do with them, get help for them, get help from as professionals, get help from families, get help from support agencies. Manage our feelings. When somebody has committed suicide, we feel guilty, we feel anxious when somebody is expressing these feelings, we feel overwhelmed and helpless. We may need some help in managing these feelings when we are helping and talking to somebody who is feeling suicidal. We might also feel angry if it is a family member who has attempted suicide. We feel angry. Why have they done that? Why did you do that? These are feelings that we need to. And then feelings of suicide survivor. Somebody has survived suicide. They need very sensitive management, express empathy, genuine concern that we should show, and struggling about loved ones' eternal status, people who have gone, our suicide survivor, people who have lost members of their family to suicide, they need a lot of support. Express empathy to them, come alongside them, offer genuine concern, because many of the family members will be going through feelings of guilt, shame, anger for not doing anything, or feeling that they have not done anything that would have prevented the loved one's suicide, that they didn't even pick up that their member was suicide, they feel ashamed about, guilty about. And so these are things that we can help that person to overcome. And they might feel suicidal themselves because they're struggling with what's happened to their loved ones. I tell you, it's a real trauma if a child of yours or a loved one of yours has committed suicide, a real traumatic event and upheaval emotionally that people go through. Pastoral care, I'm not going to go through. Acceptance. See, every one of us needs these 4 A's. Acceptance. We all need to feel accepted, belong to a community. Every human being needs affirmation because many people who have got lack of meaning and purpose and hope, we all like to be affirmed. We all want affection because relationships are often disrupted. We need affection. Every human being any human being doesn't need it, and we need appreciation. Many people who have got poor self-image. I tell you, as a general secretary of the EMFI, the number of medical students I've spoken to and I've found who have a poor self-image. I'm not going to go to that today. That's a topic by itself. Why do we have in India lots of people with poor self-image? So everyone likes appreciation. Something I've learned, a late life lesson for me personally, that I have not appreciated and said that to my children. And I can see defects in, we've got 4 children because I did not do much of that. So, and then when we do acceptance, affirmation, affection, appreciation, people begin to develop trust in us. When we do that, people begin to develop trust and confidence in each other, and then they began to be open, because trust generates openness, and openness leads to sharing. Openness leads to sharing. See what happens when we accept people, we affirm them, accept people as they are with all their problems. There's no one who is perfect. Accept them. When we begin to affirm them, we show them affection, appreciation, they begin to develop trust. Trust leads to openness, and openness leads to sharing. And then it will be an opportunity for us then also to pray with them. 6 reminders for those struggling with thoughts of suicide. So somebody who's going through suicide, these are things that we can tell them. We have a real enemy whose mission is to steal, kill, and destroy. Who's that? The devil. I talked about it earlier. Choose not to be driven by fear. Know that you are never alone. There are people around you. You might think in the state that you're alone, but there are always people. Know that God loves you and is always with you. Know that he does not condemn you or accuse you. Remember that he has a plan for good in store for you. These are things that we can share from a Christian point of view with Christians who are feeling suicidal. And as a church, educate ourselves and congregation like what you're doing. We need more of this to educate our church community in this whole area. Know the resources that are available locally. It's good to have a mental health awareness Sunday in all our churches. I don't know how many churches here have that. Many churches in Australia do have a mental health awareness Sunday to talk more about mental health issues and encourage conversations about mental health issues, suicidality, and encourage prayer requests about these areas. Encourage faith community to offer support and care. Provide leadership in breaking the stigma. As I say, my passion is to break the stigma about mental illness, about suicide, and to be able to talk more openly about all these matters. So I won't go into that. It's about, after listening to all this, how do we view the story of Mary, story of Thomas? Again, after we have listened to all that, will we view these people differently? How will we be able to help them, maybe with some of the resources we heard about? Then we talk about prevention of suicide. Family support is especially supportive partner is very important. In all mental illness, we come back to the community support. friends, church, cell, prayer groups, importance of faith, learning coping strategies for stress and trauma, which I've been talking a lot of these past few days to many groups, and purpose and hope for living. Importance of a good self-image. Some conclusions as we come to an end. Suicide is a tragedy and a loss, and never to be encouraged or seen by Christians as a positive good. Suicide is always a tragedy and a loss. Some suicidal people in crisis say fear of hell has kept them from killing themselves. This is very, very important. Telling people that suicide condemns them to hell may not keep them from the act, because the hell that they are experiencing now, what they are going through, maybe through their severe depression, may be worse than any eternal hell they fear, what they're going through now every day. So just telling them, hey, you commit suicide, you're going to hell, is not going to prevent many people, because they feel that the hell that they are going through daily is worse than any eternal hell they can dream or think about. Many Christians, if they were really honest, would talk of times of depression and desperation with thoughts of death and dying. The bottom line is that the Bible says nothing about God's response to suicide, so all our theologies are conjecture. Bible does not say, as I've said before. So whatever we think, it's all our theories and conjecture. Even Christians can, and I've already shown you examples, and do take their own lives. Central to all ethical deliberation is the question, how can we be open to a more humane, compassionate response without giving the impression that suicide is acceptable for anyone under any circumstance? And this, as Christians, I hope, final message, take-home message, as Christians, we should worry less about whether Christians who have killed themselves go to heaven. That is up to God. And worry more about how we can help people like that find hope in living. Let me repeat that again as a final take-home message. As Christians, we should worry less about whether Christians who have killed themselves go to heaven, whether it's a sin or not, and worry more about how we can help people like that find hope in living. And the Bible says nothing will be able to separate us from the love of God in Christ Jesus our Lord. All right, God bless you. And I will stop sharing. I hope some of these have been helpful, and we have quite a bit of time for questions and for discussion as well. All yours, Sister Vanilla.
Sir, thank you very much for the detailed presentation on suicide, sir, and theological perspective on suicide. Sir, sometimes students might be coming across other students who are suicidal, and the person who is suicidal might not want the friend to tell to anybody, or at least not to the parents, because there are a couple of reasons they share. One, parents will get worried. Two, they don't understand about depression and mental health. So how do one of the students from EMFI deal with such a person who is going through suicidal tendencies?
Good question. And as I said, this is an area we have to sometimes break confidentiality for the safety of that person. So this is where we need also the wisdom and discernment. They're talking about suicide. The questions that I gave, have they ever attempted it? Have they thought how they're going to commit suicide? Have they thought what the effects of it is going to be? Have they ever, so we can, in our discussion, we can probe these questions and begin to understand how seriously they have been thinking. Is it been just a fleeting thought that has come, or they have gone further than that? If they have, then even if they are away from home at this point in time, they're in a college, they're in a hostel, even if we don't tell the family straight away, we need to tell someone who, or professional or someone that can help them. Because if they do end up committing suicide, the guilt and the stress and the trauma that we will go through because we didn't share that with somebody who can help that person. So I know it's a fine balance. Sometimes it's very difficult to break that confidentiality, but this is one area where we need to be very, very discerning about, and one area where I would say that even breaking the confidentiality would be acceptable, because we cannot risk at the end of the day somebody taking his or her life.
Thank you so much, sir. Are there any questions? If so, you can ask. There is somebody who wrote that suicide is not sin, but some churches do not allow burial in the graveyard meant for Christians, for those who have committed suicide.
I know that. Yes, I know that. And I'm not here to condemn them, because they obviously come from the theological view that suicide is sin. These people are going to go to hell. But there are many people that we bury who we don't even know whether they're going to hell or heaven. Ultimately, it's Lord's the Lord's decision, our God the Father's decision. So are we saying that all these people who are buried there are going to end up in heaven? We don't know, and I personally, I feel that is very sad that we do that. Already the families are traumatized by the fact that their loved one has committed suicide. They have lost someone in a tragic circumstance, and now the church is saying you can't bury them here. I feel is tragic. That's all I can say. Yeah.
Thank you, sir. But these days we have been seeing that medical students have been committing more suicides, and suicide rate has increased, especially last couple of years, even among medical students. We like to dwell on why and what has changed, and was it the same long back, or things have changed now?
I think many of the things that we spoke about today, even in the mental health area, I was saying, why? Because one, we have less support systems, we have less relationships which are meaningful. We spend more time on social media. We get a lot of our information stimulus from not human beings. There is maybe pressure socially to achieve. When we don't achieve, then we feel that life is not worth living. So there are multiple things. I think it's not just a single thing which has caused this increase of, as you're saying, the number of students that are committing suicide. It's again a sad situation. So it's not one single factor. I think there are multiple factors that's resulted in the increase of incidents of suicides.
Thank you so much, sir. So, any more questions from the audience? So, if there are no more questions, then we can conclude this session. Thank you so much, sir.
Vanilla, 1 second. Sorry. Or, can you throw some light on discerning between psychiatric illness and something related to a spiritual attack or warfare? I see people struggling between discerning between a psychiatric illness and And some people also feel that it's a, it's a spiritual warfare or a demonic attack. So how to discern? Is there any, methodology or any approach to this kind of situations?
Yeah, okay, so there are three things there. Is it a mental illness? Is it a spiritual attack? Or you're saying whether it is due to demonic influences?
Yeah.
How do we discern that? So let me put aside the demonic influence. I do not claim to have any special gift in that area to the gift of discernment in that area. But I can say this, I mean, after the many patients that I've seen over the years, many hundreds of patients that I've seen in my psychiatric practice, when people have asked this question, I've said, maybe there might be maybe a 2 or 3 patients where I have thought, could this be more than a mental illness? Could there be a demonic factor involved here? Because many of their psychiatric symptoms and signs do not tie up very much with what we classically would say fits the category of a mental illness. And there seems to be differences there, and I begin to question whether there's something else happening here. The other thing is, you see, again, there probably would be more incidences of that here in India compared to where I've been. My psychiatric practice has always been in the West, either in UK or now in Australia, where it has, which is breaking down now, but it was a lot of Christian influences. But now it is breaking down, and more people are involving themselves in the occult, in witchcraft, in demon worship. They even have, temples of demon worship. People are getting involved. So they're opening themselves to the influence of the devil. So there's more opportunities of that happening. And so it's probable, I have come across many missionaries who have worked in countries where witchcraft and is actively practiced, and they've said they've come across cases. So I'm not negating that it happens. And maybe in India, where there is more idol worship, more occultism, so there could be probably more cases of demon possession and demon oppression compared to what I have seen in the West. So I accept that. But what I'm saying is we need a gift of discernment. Not every one of us has that gift, to discern that. But coming to the other part that you have asked, whether it's mental illness or a spiritual problem that the person is going through. You see, if you look at the definition that I gave in the beginning about mental illness, I mentioned that anything that, when you say it's got to be a mental illness, is something that happens in that person's life which affects either them to the point that they are not functioning as well as they do, or it affects the relationships and other social relationships that is breaking down. Either them, in the college, for example, if you're a student, they are declining in their function. They were quite a good student, and now it seems to be progressively they're getting worse, not studying as much, not concentrating as much. They are failing exams when previously they did well. That is a sign that is probably a mental illness. Similarly, now they are having their behavior, etc., is impacting other people to the point of distress. Then it could be a mental illness. Very often you find that if it's a spiritual factor that's going on, it is a person who is struggling with it rather than other people, or they're not declining. It's that they're struggling with spiritual things that they're going on. So there's usually that distinction that if it's a mental illness, it impacts the person in many, many different ways, rather than that they are having spiritual thoughts and struggles that they're going through. Does that answer to a certain extent?
Yes, sir. Thank you.
And again, spiritually, when you psychotic symptoms, people begin to have, this is well-known fact as well. When a more spiritually inclined person begins to become psychotic, for example, either they are schizophrenic or mania or depression, many of their psychotic symptoms are about spiritual matters. Do you understand? They talk about more about God and God's power and God doing this or evil spirits affecting them. So it becomes more spiritually inclined. While a person who has been always money-minded, when they become more manic or schizophrenic, it's all more to do with money matters, etc., that they'll have delusions about. So what we are preoccupied when we become ill, we also show a tendency to show symptoms more in that, the content of the symptom more in that area.
Thank you, sir. Vanilla, do we have any more questions?
No, I'm fine.
Okay, friends, if you have any feedback or if you would like to share any feedback with sir, you can, we have few more minutes. I think you can share your feedback on this, and the session is available on the YouTube also for our friends to view at whenever they are convenient. If you feel, I request you to feel free to share your feedback. So there's a feedback from Krupakant. Krupakant, would you like to say anything?
And also, I think in my last slide, I gave my email address. If anybody wants to communicate it, I'm always happy to communicate with anyone. Yeah. It's drkgvilla@gmail.com. Quite easy. drkgvilla@gmail.com.
At sir, Dr. KG Villa at
gmail.com.
So friends, we'll wait for 1 or 2 minutes. If we don't have any feedback, I think we'll be winding up the session. Dr. Vishnu, Krupakant, Sharada, Blessy, Praveen, Ravana, Suvanjyoti.
Good evening, everyone. First of all, I'm very glad to be part of the online program today. Personally, I'm very much benefited. Thank you so much, Anna. Really, really informative, and many of the doubts which were there especially in my mind, though I had some clarity on